Hi everyone, good evening. How are you people? Hello, hello, hello. Good evening everyone. Good evening. Dr. Bharat, Dr. Arafat, Dr. Yes, Vidhi, everyone, Dr. Rahul, Abhilash, yes. Yeah, I'm good. I hope all of you are doing great. Dr. Meghna, Dr. Archana, yes, Dr. Pratiksha. काफी सालों के बाद दिख रहा हूँ. Dr. Ritwik. Yeah, class will be up to 9 o'clock. Yeah, I'm good, Dr. Umesh, Dr. Navya, all of you. Yeah. So how about your preparation going on, Dr. Minesh, Dr. Navya, all of you? So far, how many subjects you have completed, all of you? Bolo. So far, how many subjects? Okay, Dr. Nahita, I'm glad. ठीक ठाक नहीं, ठीक ठाक से तो काम नहीं चलेगा. डॉक्टर स्थिति, डॉक्टर विशाल, डॉक्टर मिनीश, डॉक्टर शहजादी, इस्लाम, डॉक्टर विधि. हेलो हेलो हेलो. Yeah, yes, I'm also glad to see people. See, ये बताओ, see, so far, one thing, I think hardly 55 days are left, right? No, hardly 55 days are left, right? 55 days. Okay, 50 days. I think I can expect only 50 days. Like 6 July, you will be having exam on 6 July, right? Hana? So last 45 days should be empty. Last 45 days only, only revision, only test and discussion, and like only golden points should be there. And this time, see, like in June exam, see, I'm telling you, June exam mostly clinical, right? Mostly clinical. See, like 70-80 questions will be one-liner for sure. 70-80 question will be one-liner for sure, but you can expect 190 to 200 will be up to clinical. Okay. कुछ भी याद नहीं रह पा रहा है. See, I'm telling you one thing. See, whatever you have learned before, you have to sit and revise. You do not have any other option. You have to sit and revise. You do not have any other option. So once you are revising, once you are learning, after that, Dr. Umesh ne pura FMT pura dobara hoga. Again, FMT we are going to complete again, right now. So whenever you'll be revising for the second time or the third time, you will be able to recall. तो उसके लिए परेशान मत हो. Don't worry about about all these subjects which you already have completed, right? चलो fine. So we can start with the psychiatry. कोई बात नहीं डॉक्टर सुति जी, सब आएगा, धीरे धीरे आएगा, slowly आएगा. 6 to 8 mock exams you are supposed to write. 6 to 8 mock exams. Sir, according to you, what will be the difficulty level of June exam? As people say, it will be difficult. See here, as per the experience, Dr. Ravinder, like FMT, I will be taking here. Online FMT, I will be taking. Okay. See here, as per the experience of last 1 or 2 years, right? Remember here, June exam will be somewhat difficult than before. As per the experience, I'm saying as per the pattern. Basically, no one can predict the exact pattern of exam. But mostly June exam will be having lengthy questions. Long questions will be there, right? Now, long questions will be there. So you have to be ready for that. I expect in June exam, 80 to 90 questions will be one-liner. Remaining all other questions will be big questions or like clinically oriented questions. But whatever you have learned, yes, you will be able to understand the question. So it does not mean that like exam will be very difficult. No, exam will be up to the normal level, but you will have to decode the language. You will have to understand. You will have to integrate the subject. Okay, and for that you need more and more question practice. Right now, yes. So 15 minutes. Yeah, Dr. Minesh, I will explain you. Don't worry. सर लास्ट में सब्जेक्ट का रिवीजन कराएंगे ना? यस, आई विल डू इट डॉक्टर सुधि, आई विल डू इट. स्ट्रैटेजी बता दो कैसे पास हो जाएंगे. ठीक है, तो एक काम करते हैं, आज पहले हम लोग साइकेट्री स्टार्ट करेंगे, ठीक है ना? लास्ट डे जो होगा, लास्ट डे में फिर से कुछ स्ट्रैटेजी इसे प्लानिंग करते रहेंगे थोड़ा, ठीक है? सो लेट मी स्टार्ट विद द साइकेट्री नाउ. Okay, Dr. Rahul, I will be using 99% of English. Okay, very few sentences I will be using in Hindi. Don't worry about that. Okay, so chalo fine. So let's start with the psychiatry now. See, psychiatry notes which I have given you now, this is somewhat actually shorter than before. Shorter than before, I'm saying. Okay, fine. So basically, we are going to emphasize more on those topics from where they are going to frame their questions for sure. Right now? Okay, fine. So where I will be asking you, okay, so highlight it, mark it. So there you have to make a circle. You have to highlight it. From there only, so they are going to frame the questions. How many questions you are expecting from psychiatry? How many questions you are expecting from psychiatry? Bolo? To 30? No. 5 questions will be 100% from psychiatry and 4 to 5 questions will be related to psychopharma. So in total, we are going to learn for 9 to 10 questions. Okay, 9 to 10 questions, pakka. 9 to 10 questions. All psychopharma I will be teaching you in detail. 5 questions will be 100% related to psychiatry, only diagnosis, how to diagnose schizophrenia, how to diagnose panic attack, how to diagnose anxiety, how to diagnose depression. But 4 to 5 questions will be related to medicines, related to psychopharmacology, how to deal with the patient, how to diagnose the case, how to use any medicine, what are the side effects, what are the complications, right? What are the complications? So all these things I'm going to teach you. So in total, we are going to prepare for 9 to 10 questions, 100% sure shot, right? Sure shot. Day after tomorrow, psychiatry will be last. आज का class होगा 4 to 9 p.m. Okay, so Dr. Vidhi, from my side, everything is clear. You please, you recheck your Zoom, okay? Okay, Dr. Sayyada, in total 9 to 10 questions. Dr. Umesh, no problem at all. I will make it very much easy for you. Don't worry, okay? Yes. Dr. Ashwini, last day I will explain you. Don't worry about that. Okay. Chalo, fine. So let's start with the psychiatry now. Okay. Chalo, fine. I hope all of you have received the notes. Okay. Chalo, fine. See here, remember here, we are going to prepare for 9 to 10 questions. 9 to 10 questions. Okay. My screen is visible to everyone. My screen is visible to everyone. Yes, my voice is clear. Yes. Okay, let's start. Yes, let's start the session now. Chalo, fine. Okay. Okay, chalo, fine. So I'm starting. So I'm starting from the 0 level. Okay. See, first of all, I expect the first chapter minimum 1 or 2 questions we are going to see from the first chapter. Minimum we are going to expect 1 or 2 questions, right? No, 1 or 2 questions. See, first is what? Organic and non-organic disease. See, if I ask you what is the meaning of organic, see, so many places, at so many places you hear this word, no, organic khana khao, organic ye wo, this that. My question is that what is the meaning of organic? Bolo. Meaning of organic boliye. Meaning of organic. Okay, genuine you are saying? Okay, yes. See here, organic means real. Organic means actually natural. Organic means actually natural. Organic means real. Right now? Real. So that should be what? Authentic. Authentic. Chalo, fine. So we are going to understand organic and non-organic mental disorder. First of all, suppose if I am having patient A and patient B. Patient A suffered road traffic accident where I can see head injury, where I can see some bleeding also. My question is that if there is a case of head injury, what is the investigation of choice now? Bolo. Yes, Dr. Venkat, very good. Okay, fine, very good. Yes, my question is that, okay, you are writing MRI, you are writing CT scan, you are writing. NCCT you are writing. Very good. Yeah, radiology is over. Radiology. E fast. Dr. Ashwani, E fast you are writing. Acha, city head you are writing. Very क्या बोलूं मैं अब, कोई बात नहीं, चलो फाइन, वेरी गुड. GCS. अरे नहीं नहीं बेटा, ये बताओ सबसे पहले फाइन. देखो, ऑलवेज कीप इन माइंड ABCD यू आर डूइंग है. इतना गलत कैसे हो सकता है? GCS करोगे. Investigation of choice, I'm asking you. Investigation of choice. My question is that head injury, I can see bleeding also. I can see bleeding also. What is the investigation of choice? I'm talking about what? Investigation of choice. Investigation of choice. Acha, X-ray of head. Wow. MR, visual examination. Arre, wow. But a bleeding ho raha hai. Patient is having bleeding. You will do visual examination. Eh? How much is the flow? Is it so? बायोप्सी कर देंगे. अरे रे 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 रे. बायोप्सी ऑफ क्या? सेरेब्रल कॉर्टेक्स. चलो अच्छा है, अच्छा है. और गलती करो, मुझे अच्छा लगता है जब आप गलती करते हो तो, है ना? नहीं चलो ठीक है, ओके वेरी गुड, ठीक है कोई बात नहीं. यस, आई कुड सी योर आंसर्स एंड like 50% of you are correct and 50% of you are wrong. ठीक है. So the topic what I am going to write down here, please write down and always keep in mind, never forget it, because this is repeatedly asked question in FMG. Always keep in mind, whenever there will be acute head injury, whenever there is acute head injury case, whenever you can see bleeding, first investigation and investigation of choice is always NCCT. NCCT. What is the full form of NCCT? Non-contrast CT scan. So now if you ask me, sir, why it is not CECT? Why it is not CECT? CECT full form क्या होता है? You have to inject one contrast, right? No, you have to inject one contrast, right? Very easy to understand. You have to inject one contrast. My question is that, so now suppose if I have a patient in my emergency department, yes, and I can see that patient is having bleeding from the head, obviously. So if I have to inject any contrast, do you think I have to perform any blood test before I inject any contrast? Yes, I have to do what? Renal function test. Renal function test. Renal function test, or you can say kidney function test. So especially which parameter I should check here? Especially which parameter, can you tell me? Especially which parameter? Very good, Dr. Shrishti. Very good, Dr. Abhishek. Okay. Creatinine. Please write down. See here, along with this psychiatry, I will keep on speaking about some clinical aspect also. So please keep on writing separately or anywhere, but keep on writing. Remember here, why we have to check this serum creatinine? Why? Because if a level of this is more than 1.5 milligram per deciliter, please keep in mind, injection of any contrast will be contraindicated. Injection of any contrast will be contraindicated. Easy to understand. So that's why. So basically, I have a patient in emergency department, and at that time, suppose if I have to check a renal function test, it will take minimum 1 or 2 hours for the report to come. So are you going to wait for that much time? Obviously no. Patient is having severe bleeding now. Patient is having severe bleeding. You cannot wait for that much time, right? Okay, fine. First important point, first of all, you have to check renal function test. Second important point, why CCT is not the investigation of choice? Why? Because there is a fresh bleeding. There is what? Fresh bleeding and dye mix ho jayega, right? No, so fresh bleeding hai, so that's why CCT is not the investigation of choice. NCCT is the investigation of choice in any head injury case. Please always keep in mind, without any contrast, you have to perform CT scan as soon as possible. As soon as possible. समझ में आ गई बात? Easy to understand. Never ever forget this word, that investigation of choice in any acute head injury, wherever there is bleeding from the head, please do NCCT. One-liner question, repeatedly asked question in neurosurgery. Repeatedly asked question. Chalo, now get back to psychiatry. My question is that, In patient A, where patient had a road traffic accident, where I could see the bleeding, if I do CT scan, do you think I can see some changes in brain parenchyma? Do you think मुझे कुछ changes नजर आएंगे? Do you think I can see any damage in brain parenchyma? Yes, I can see any damage in brain parenchyma. If I can see any medical cause, if I can see any natural cause, any real cause in the brain, if I can see any changes in the brain, if there is any mental disorder, this will be called as organic disorder. Simple logic समझ में आ गई बात. Patient number B, non-organic case, who is actually a doctor, who is standing in operation theater. Operation theater is on 4th floor. Operation theater is on 4th floor. During this surgery, suddenly he is asking the nurse, Sister Ji, why this buffalo is singing a song for me? What does it mean? He is having auditory hallucination. He is having auditory hallucination. He looks very much fine, very much stable, very happy. He was operating, but suddenly he is asking the nurse, Sister Ji, why this buffalo is singing a song for me, right? So what does it mean? Now, if you do CT scan in this doctor, do you think you are going to see some changes in brain parenchyma? Are you going to see any damage in the brain? No. Very good. बस इतना ही याद रखना है. If you can see some changes in brain, it is called as organic disorder. No changes in brain parenchyma, non-organic disorder. याद रहेगा? Very easy to understand. Simple logic. Very good. चलो अब ये बताओ. I hope all of you have learned about Alzheimer's disease. I hope all of you have learned about Alzheimer's disease. My question is that Alzheimer's disease mein, are you going to see some changes? Bolo. Are you going to see some changes in brain parenchyma in Alzheimer's disease? Are you going to see some changes on a radiological investigation? रेडियोलॉजिकल में बोलो, न्यूरो पढ़ लिया होगा, पैथो फिनिश, मेडिसिन फिनिश. Yes, please write down. देखो समझो इसको. Remember here, when you do radiological investigation in Alzheimer's case, what will you see? Cerebral cortex will become small. Small cerebral atrophy you see. Cerebral atrophy you see. In Alzheimer's case, remember here, cerebral cortex will be shrunk, छोटा हो जाएगा size उसका. Atrophy of cerebral cortex in Alzheimer's disease. So if I ask you one question now on a radiological investigation, you can see some changes in brain parenchyma in the cerebral cortex in case of Alzheimer's. So Alzheimer's will be called as a disorder of organic or non-organic. Answer करो. Organic. Simple है ना? Organic. Right. Very good. Alzheimer's is old age disorder or young age disorder? बोलो. Old or young age? Old. Simple. So most of the organic disorder will see in old age. Now you have a table in your notes. Please start writing. Start writing now. Please start writing now. See here, when I say organic mental disorder, yes, there should be some medical causes for sure. Medical causes होंगे. Yes. Non-organic, no need of medical cause. Brain parenchyma, are you going to see some? See here. No, Dr. Ashwin, CJD is also what? CJD is also what? Organic disorder. That I will explain you. That is a type of cortical part. Okay. Chalo, fine. See here. That will be coming in organic part. Okay. So now the brain parenchyma, please write down. Are you going to see some kind of insult or damage of brain parenchyma in organic disorder? Answer is yes. Non-organic, no. Age, please write down. Organic, mostly old age disorder. Non-organic, remember here, non-organic mental disorder is also called as functional mental disorder, right? No, functional. Okay, functional. So remember here, most of the psychiatric cases are non-organic. Most of the psychiatric cases are non-organic, right? And most of these psychiatric cases will start in young age. यंग एज में, अभी आपका जो एज है ना, मोस्ट ऑफ द केसेस विल स्टार्ट इन यंग एज एंड स्पेशली इन द adolescent age, young age, right? Okay, fine. So please write down age, young age. Dr. Haja Najibuddin, how accident is old? नहीं, वो तो acute हो जाएगा ना, that will be organic. उससे जब भी अगर किसी को trauma होगा ना, see, I am saying that most of the psychiatric cases will start in young age. So it does not mean 100% case will not start in young age. No, most of the cases I'm saying, okay? Now, see here, now you tell me, so where you will see disturbances in the consciousness, where will you see mental confusion? Mental confusion, accident के बाद होगा या without accident हो जाएगा? Organic, right? No, so please write down, in organic mental disorder there can be mental confusion. What are other synonyms of mental confusion? What are other synonyms of mental confusion? Please write down, disorientation to time, place and person. Please write down, disorientation to time, place and person. Disorientation to time, place and person. What is the meaning of disorientation to time, place and person? After head injury, if a patient is coming to your emergency department, you are wearing a white coat and that person is asking you, hey, are you Sanjeev Kapoor? Are you chef? Oh my God, what kind of shopping mall is this? No music, no lighting. Oh my God, is it jail? Oh my God, is it day or night? Is it morning or evening? Basically, he's completely disoriented. Is completely disoriented, right? It is also called as altered sensorium. Altered sensorium. Yes, very good. It is also called as altered sensorium. Senses got altered. Please write down one more word. It is also called as clouding of consciousness. Please write down, all of you, please write down. It is also called a clouding of consciousness. Clouding of consciousness. In easiest language, it is called as mental confusion. It is called as mental confusion. Very easy to understand. Right now, so I can say that in organic mental disorder, yes, there can be mental confusion. There can be clouding of consciousness. Clouding matlab kya ho gaya? Uske yani ki, so there will be a cloud over the consciousness, simple altered sensorium. So please write down, in organic mental disorder, yes, there can be clouding of consciousness. Mostly yes and no also. So please write down, in organic mental disorder, there can be mental confusion, but non-organic mental disorder, it is no. Please write down, non-organic means what? Person will be well oriented. Here a person will be well oriented. Psychiatric patients will be well oriented. They do not have any mental confusion. They do not have any mental confusion. I hope all these points are clear to everyone so far, right? Chalo, fine. So ये सब चीज समझ में आ रहा पूरा? See, I'm teaching you from the basics. बिल्कुल एकदम zero level से. Basically, see here, over what is my target? During the class, we are supposed to memorize everything. We are supposed to learn, memorize, and solve the questions also. Okay. So now you tell me, where can you see neurological deficit? Where can you see? See here, where can you see? Dr. Haja, I will teach you. Don't worry. Don't worry. I will teach you. Aega pura aega. See here. Now, so where you can see मतलब कि neurological symptoms कहाँ पे आएंगे बताओ? Neurological, like there can be visual disturbances, speech problem. There can be the palsy. Obviously, in organic mental disorder, you can see, not in the non-organic mental disorder. Hallucination can be seen in both organic also, non-organic also. But remember here, in organic mental disorder, mostly there will be visual hallucination. Non-organic, mostly there will be what? Auditory hallucination. Please write down, overall overall most common type of hallucination is auditory. Please write down here itself. Overall, most common type of hallucination is auditory. But if examiner is asking you specifically in organic mental disorder, which type of hallucination? Visual. Non-organic में auditory. ठीक है? Please write down the example first. Organic mental disorder example like delirium and dementia. Delirium and dementia. Remember here, delirium is always acute. So always please write down organic mental disorder. It can be acute. Yes, it can be acute. Means sudden onset. Non-organic is never acute. बस इतना ही याद रखना. Non-organic में example please write down like schizophrenia, like depression, so many examples are there. I hope all these points are clear to all of you. ठीक है? Now overall देखो अब यहाँ पे सी है. Now without seeing the note, first of all you please finish writing. एक बार लिख लो. First of all you finish writing. After that I will ask you the question and all of you please start writing in the chat box. Speed में लिखो सब लोग. जितना याद आता है उतना लिखो. See, suppose if I ask you out of organic mental disorder, non-organic mental disorder, which one is old age onset? बोलना जरा. Old age onset. Organic disorder. Okay, fine. Now you tell me. So where you can see mental confusion, organic, non-organic. Or short form में लिखो. जल्दी short form में लिखो. Okay, now you tell me. So see here, which one is a young age onset? Which one is young age onset? Non-organic. Okay, fine. ये बताओ. Suppose if I am doing radiological investigation and I do not see any changes in the brain parenchyma, organic or non-organic? Very good. See here, now you tell me which type of hallucination is most common in non-organic mental disorder, visual or auditory? Auditory. ये बताओ where you can see neurological problem. Where you can see neurological problem, organic, non-organic? Organic. Which can be acute, organic, non-organic? Organic. So overall, आसान भाषा में, in easiest language I can say that organic disorder is called as the disorder of brain. Non-organic is called as disorder of mind. आगे बात समझ में? Simple logic. Now if I ask you one question that Alzheimer's disease will be considered as an example of organic or non-organic? Organic. Simple, right? Organic. Very good. Now let's solve the question which they have asked in last time FMG exam. Now understand the language of my question first of all. This was the question in FMG last year FMG, I think in January question. Which of the following is not seen in a medical cause of mental disorder? Do you understand my language? Which of the following is not seen in the medical cause of a mental disorder? Basically what examiner is asking you here? Organic disorder. Very good. Organic one है, medical cause हुआ ना? Organic disorder. ठीक है, तो क्वेश्चन क्या था? Which of the following is not seen in medical cause of mental disorder? Option number 1 was old age. Option number B was mental confusion. Option number C was acute onset. Option number D was auditory hallucination. Simple. देखो, now all of you can see. Yes, all of you can solve this question. Very good. So this is our purpose, to understand the language, how to decode the language. This is important. ठीक है, इसी तरह समझो क्वेश्चन को. Very nice. ठीक है, चलो. Now we have learned organic and non-organic. Now we are going to learn, see here, non-organic mental disorder, which is also called as functional mental disorder. Right now, most of these psychiatric cases are non-organic. This is further divided into psychosis and neurosis. Okay, now again we are going to learn how to differentiate psychosis and neurosis. Again, I'm having actually two patients, patient A and patient B. Patient B is suffering from OCD of contamination. Patient B is suffering from OCD of contamination. OCD full form क्या होता है बताना जरा, all of you. OCD full form obsessive and compulsive disorder, right? Obsessive and compulsive disorder. Very good. So like, see, we can easily understand that. So this patient was actually my friend only. He was my friend only. He was suffering from OCD of contamination. OCD of contamination means what? A person will be having uncontrolled thoughts that, and I can see here, a person will be having uncontrolled thoughts that your hands are dirty, dirty, dirty. Wash it, wash it, wash it. He knows it. He knows it that these thoughts are weird. He knows that these thoughts are irrational. He knows that कि ये जो बिल्कुल गलत सोच है. He knows that these thoughts are weird, these thoughts are irrational, but he is not able to control. He is not able to control. So basically, whenever he wants to control that these thoughts are weird, these thoughts are meaningless, whenever he wants to control, he is having anxiety. He is having anxiety. And just to release the anxiety, he has to wash it again and again, again and again, again and again. This is called as OCD of contamination. OCD of contamination. And OCD of contamination. Very good, very good. So my question is that in OCD of contamination, patient is aware about his disease or not? Answer me yes or no. Patient knows or not? Yes, yes, he knows it. Yes, he knows it. Yes, he knows that these controls are, see here, he knows that these thoughts are irrelevant. He knows that these thoughts are weird. He knows that these thoughts are irrational, but he cannot control. So this awareness about disorder is called as insight. Please write down. Awareness about disorder is called as insight. Awareness about disorder is called as insight. Please write down insight. If insight is present, it is called as neurosis. If insight is present, it is called as neurosis. इतनी बात समझ में आ गई? ठीक है. अब ये बताओ मुझे, तो जैसे मैं इसका आपको मैं एग्जांपल देता हूं. लेट मी गिव यू वन एग्जांपल. दिस OCD of contamination, I had a friend. I had my friend. He was in ortho PG JR1 first year, PG first year. He was suffering from OCD of contamination. Okay. On day one of operation theater, what happened? No. So what happened? So see here, like there was the case of radial bone fracture. So his seniors asked him, better go and wash yourself. So we are going to start the procedure, and now you come back and join us in between. Now you tell me, being a surgeon, for how many times you will be washing your hands? Maximum? Only for 3 times? Okay. Maximum for how many minutes you will be washing? 4 minutes. 5 minutes maximum. My friend Ortho JR, he started washing his hands and he finished after 45 minutes. When he got back to operation theater, now you tell me how his seniors will welcome him. Huh? How his seniors will welcome. Arre sir, aapke bina sir, without you, how can we start, sir? Huh? Do you think so? Your seniors will be welcoming you like this? Obviously, no. Seniors will bang you in hospital. Huh? Honey? Right? So yes, he got scolded, he got abused in front of everyone. Right? So everyone shouted on him. Obviously, everyone shouted on him. So now you tell me, see, first day in operation theater, when he got abused, when he got scolded, do you think he can go into depression? Yes, he can. Do you think he can develop anxiety? Yes. So do you think like, he will not be happy right now? Yes, he will not be happy because of OCD of contamination. Very good. इतनी बात समझ में आ गए? ठीक है, fine. Now, see here. Now, see here, patient A, he was suffering from delusion of grandiosity. After watching movie Bahubali, when he comes out, he started behaving like Bahubali. right? When someone is saying, hey, you are just a common man, shut up, sit down, so, shut up, this is my Maheshmati. So now you tell me, do you think he is aware about his disease? Huh? No. So insight is absent or present? Obviously, insight is absent. When insight is absent, it is called as psychosis. When insight is present, it is called as neurosis. Easy to understand? Easy to understand? Right. My question is that, so my friend who was suffering from OCD of contamination, who was suffering from OCD of contamination, right? No, OCD of Dr. Haja Najibuddin, OCD means, OCD does not mean insight. No. OCD is a different disorder, which I will teach you. See, what is the meaning of insight? See, insight means awareness about disorder. Please write down, all of you. Jisko nahi aata, please write down. Insight means awareness about disorder. Suppose if I'm suffering from malaria, yes, I know that I'm having fever because of malaria. Insight is present. मुझे पता है. When I know that I'm having some problem, that is called as insight. Insight means awareness about disease. Awareness about disease. So in a psychiatric case, if patient is aware about his disease, it is called as a neurotic problem. So OCD is an example of neurotic disease. So one more example, please write down. Depression. See, depression is also an example of neurotic disorder. If a person is having depression, he knows that he is depressed. He knows that he is very, very sad. He knows that he is having, like he is having the negative thought, suicidal tendency and all. Very easy to understand. I hope all these points are clear to everyone. Okay, DOG means what? Delusion of grandiosity. Delusion of grandiosity. Now you tell me, see, DOG, delusion of grandiosity. Now tell me, when I talk about OCD of contamination, so now you tell me, when my friend who was suffering from OCD of contamination, when he's going to use a public toilet, he could see that 5 people are already in the line. So he's taking a decision, okay, let them wash first. I will wash my hands in last, because if I start washing my hands now there will be biggest line in the history. So now you tell me, his judgment power is normal or abnormal? Judgment power is normal. Judgment power is normal. Right? So do you think he is intact with the reality? Do you think he understands what is happening in and around? Usko samajh mein aa raha hai agal bagal mein kya ho raha hai? Do you think like his reality testing is normal? Yes, reality testing is normal. But reality testing and judgment power in psychotic disorder will be abnormal. Will be abnormal. Will be abnormal. Very easy to understand. I hope all these points are clear to everyone. ठीक है, चलो फाइन. Now there are two psychotic symptoms. There are two psychotic symptoms. One is called as delusion, another is called as hallucination. Please write down here. Delusion is a disorder of thought. I'm thinking that I'm the most powerful man on the earth. I'm thinking that I'm the most handsome man on the earth, right? Might be. Also, so this is a disorder of my thought. So basically, delusion is false belief. That is called as what? Delusion. Hallucination is a disorder of perception. Hallucination is a disorder of perception. I can see someone which other people cannot. That is called as visual hallucination. Right? That is called as visual hallucination. And very easy to, Dr. Poonam, chalo, I'm glad. Chalo, fine. Very good. अच्छा चलो ठीक है भाई, thank you so much. चलो ठीक है, okay, very easy to understand. I hope all these points are clear to everyone. Okay, fine. All right, ठीक है, इतनी बात समझ में आ रही है ना? So hallucination is a disorder of perception. Delusion is a okay. डॉक्टर इम्तियाज पूरा क्लियर होगा इसमें. ओके है ना, आसान से पढ़ाएंगे, बहुत अच्छे से करेंगे हम लोग. ठीक है, ओके फाइन. ठीक है, चलो फाइन. So delusion is a disorder of thought. Hallucination is a disorder of perception. Perception. Okay. Chalo fine. All right. So please write down. Hallucination is a disorder of perception. Please write down. These are psychotic symptoms. So these are present in psychosis. These are absent in neurosis. Please write down. ठीक है. psychotic symptoms. Okay, so now see, now when I talk about, see, when I talk about the personality, please write down. See, personality will be normal. See, the personality will be normal in neurosis. See, when I talk about the disorder case of my OCD contamination of my friend, he's a doctor, so he will maintain hygiene, he will maintain grooming, shirt, pant, acha pehen ke aayega, right? No, so personality will be preserved. Personality will be normal in neurosis and abnormal in psychosis. Schizophrenia patient can walk naked. Schizophrenia patient can wear blanket in summer, right? Okay, fine. Yes, Dr. Ahmed Nazir. Yes. How do we perceive anything? That is called as, okay, that I will teach you in detail. ठीक है, देखो अभी समझो, आई एम टीचिंग यू फ्रॉम वेरी जीरो लेवल, सारे टॉपिक्स आएंगे, ऑल टॉपिक्स विल कम. ओके फाइन. सो नाउ व्हाट आर द एग्जांपल्स ऑफ साइकोसिस? प्लीज राइट डाउन. स्किज़ोफ्रेनिया एंड मेनिया. Schizophrenia and mania. These are the examples of psychotic disorder. These are the examples of psychotic disorder. Psychotic disorder. Psychotic disorder. याद रहेगा. Now, without seeing the notes, can you tell me, if I am doing radiological investigation, I can see some changes in the brain parenchyma. This will be called as what? Organic or non-organic? Answer करो जल्दी जल्दी. Organic. Which one is old age onset? Organic. Where will you see mental confusion? Organic. What is the investigation of choice in any head injury? NCCT. NCCT, not CCT. NCCT. So before you perform CECT, which blood investigation is mandatory? Renal function test by which parameter? Okay, creatinine. How much level should be? See, more than 1.5 means actually there will be the contraindication. So it should always be less than 1.5. Less than 1 point, more than 1.5 पे तो contraindicated है, right? Easy to understand? Very good, very good. Now tell me, see which one is a young age onset? See which one is young age onset? Creatinine, because that is easy. That is easy to perform. Okay, non-organic, fine, non-organic. Okay, fine. See, now you tell me, see here. So non-organic mental disorder is also called as functional mental disorder. Functional mental disorder is further divided into psychosis and neurosis. Psychosis and neurosis. If I ask you one question, that what are the most important parameter? What are the most important parameter on the basis of which you can differentiate psychosis and neurosis? Answer bolo. Ek word bolo. Only one word. That is called as insight. What is the meaning of insight? Awareness about disorder. If insight is present, it is called as what? Neurosis. Neurosis. Okay, judgment power and see, overall, judgment power and the reality testing will be normal in neurosis. Neurosis. Delusion and hallucination will be seen in psychosis or neurosis? Psychosis. Very good. Chalo. Now see this question and try to solve. Rule out and solve karo question. Dekho. See this question and solve karo. All of you solve the question. Rule out and try to solve the question. आराम से कर सकते हो. Yes, you can easily rule out. No? You can easily rule out, right? Option number D. Reality testing. Basically, this is a case of what? OCD of contamination. This is a case of what? OCD of contamination, which is psychotic disorder, neurotic disorder. Which is a neurotic disorder. I will explain you option number A also. Don't worry. Don't worry. न्यूरोटिक डिसऑर्डर. ठीक है ना. सो देखो इसमें एक वर्ड है जो कि सभी के लिए थोड़ा सा प्रॉब्लम क्रिएट करेगा, मीनिंग ऑफ सिम्टोनिक एंड डिस्टोनिक, राइट? बट यू कैन इजीली रूल आउट ना. यू कैन इजीली रूल आउट ना. रियलिटी टेस्टिंग विल बी प्रेजेंट. नाउ व्हाट इज द मीनिंग ऑफ ईगो सिम्टोनिक एंड ईगो डिस्टोनिक? ठीक है, चलो आप इसे प्लीज राइट डाउन. देयर आर टू वर्ड्स. देयर आर टू वर्ड्स. वन इज कॉल्ड एज egosyntonic. Another is called as ego dystonic. Please write down all of you. Syntonic and dystonic. Syntonic and dystonic. Please write down. Syntonic means agreeable to self. Please write down. Syntonic means agreeable to self. Agreeable to self. And dystonic means disagreeable. Disagreeable to self. Meaning क्या हुआ पहले ये बताओ. What is the meaning of agreeable to self? What is the meaning of disagreeable to self? If I ask you one question, homosexuality is normal or abnormal? Answer करो. Homosexuality, gay sex. Suppose if a person is a gay or lesbian, is it normal or abnormal? Some of you are saying normal, some of you are saying abnormal. See, देखो, debate is going on now. Debate is going on. Suppose if you are saying कि homosexuality is normal, they will ask, अच्छा, Russia से आया. Eh? Suppose if you say abnormal, अच्छा, who are you to say like that? Huh? Who are you to say like that? बोलो. बोलो. चलो fine. So basically we are with science. है ना? We are with science. है ना? देखो. See, suppose if a person is happy in his life. Suppose if a person is happy in his life. Okay, fine, no problem. I am a gay. I love to have sex with men. Who are you to ask me? If a person is happy in his life, yes, no problem at all. When a person feels that he is completely normal, when a person feels that he is completely normal, what does it mean? It satisfies his ego. It is called as agreeable to self. It is called as egosyntonic. Egosyntonic. But if a person is not happy in his life, suppose if a person is, oh my god, how I'm going to show my face to my society, oh my god, how I'm going to show my face to my family, how will I stay, how will I live in the world? So what does it mean? Because of this, he's going into anxiety and depression. What does it mean? It does not satisfy his ego. He is not happy in his life. He doesn't feel normal. It is disagreeable to him. It is called as ego dystonic. So please write down OCD of contamination. Please write down OCD of contamination is ego dystonic. Dystonic. And all personality disorders are ego syntonic. ये word कभी नहीं भूलना. Okay? This word, please never forget. Egosyntonic. All personality disorders are syntonic. OCD of contamination is what? Dystonic. Dystonic means what? When a person is not happy in his life. When a person is not feel normal in his life. That is called as ego dystonic. Ego dystonic. I hope all these points are clear to everyone. Now understand here. So you will be asking, sir, this was a big question. How to solve? Do we expect big questions in June exam? My humble suggestion to all of you, now whenever you are practicing any question paper, make a rule of 45 seconds. Make a rule of 45 seconds. 15 seconds. 15 seconds to read the question. 15 seconds to read the question. And after that, 15 seconds to make a diagnosis. No worry, Dr. Imtiaz. Abhi sab karenge usme, right? है ना? 15 seconds to make a diagnosis. After that, 15 seconds to rule out the options. 45 seconds strategy should be there. 45 seconds strategy should be there. 15 seconds to read, 15 seconds to diagnose, and 15 seconds to rule out the option. Keep 15 seconds safe. For every question, you can spend maximum 1 minute. Keep in mind. In this manner, you have to practice the question paper. Whenever you are writing mock exam, in this manner, you have to do. Okay? Chalo, fine. Next question. See the question. Dr. Lohit, okay, PD means actually personality disorder. PD means personality disorder. Okay, don't worry. So many people are asking about the planning strategy. Slowly I will explain you. Don't worry. Slowly I will explain you. Okay, slowly. I will be here for. Chalo, theek hai. Very good. See here, homosexuality. देखो, gay sex. Always keep in mind. Gay sex ego syntonic means normal. Gay sex ego dystonic is abnormal. That's it. Okay, easy to understand. Syntonic means normal and dystonic means abnormal. He needs to see a doctor. चलो एक क्वेश्चन सॉल्व करो. Chalo, fine. So basically, after smoking a cigarette, when you feel full of energy, full of attention, concentration. So this is because of what? This is because of what? Okay, most of you have marked option number A. Okay, chalo, we can learn now. So now my question is that why there is an see here. So overall, when there is no anatomical damage, see when there is no anatomical damage, when there is no rupture, when there is actually no, so when there is what, so no accident of the, like overall, if there is no any injury to the brain, okay, then why there is a psychiatric illness? ये psychiatry बीमारी होती क्यों है? पहली बात तो why there is a psychiatric illness? Why there is schizophrenia? Why there is depression? Why there is anxiety? Why there is mania? Right? Because of neurotransmitters. Neurotransmitters. What are neurotransmitters? Neurotransmitter. These are chemicals. These are the chemicals in our brain, in our body, neurotransmitters. These are the neurochemicals, right now. So what are the examples of neurotransmitters? Especially these four. Some others are also there, but these are the neurotransmitter. Always keep in mind, see, increase of a neurotransmitter in our brain, it will make a person hyper. Or you can say what? Psychosis. Psychotic disorder, full of energy, hyper. And decrease of these neurotransmitters will be causing what? Depression. Simple logic है, इतना याद रहेगा. तो यानी मेनिया है किसी को, साइकोटिक सिम्टम है तो इंक्रीज ऑफ न्यूरोट्रांसमीटर, कोई अगर डिप्रेस्ड है डिक्रीज ऑफ न्यूरोट्रांसमीटर. सिंपल लॉजिक, very easy to understand. Now let's learn about these neurotransmitters. Let's learn about these neurotransmitters. Remember, yes, whenever you abuse any substance, bhang, ganja, hashish, whatever you want, cocaine, cigarette, kuch bhi lo yaar tum. After that, you are getting kick. जैसे कुछ ले उसको suddenly you are getting kick, है ना, पूरा hyper हो जाता है kick. This is because of what? Because of what? Dopamine. Please write down. Dopamine is called as a neurotransmitter responsible for kick. Please write down, all of you. Please write down. Dopamine is responsible for kick. After any abuse, any drug abuse, you will feel very happy also. So because of dopamine also, this is responsible for reward, happiness, reward. I got Dr. Swarup, it will come. Don't worry about all this, okay? I got. So dopamine is responsible for kick, reward, pleasure, and addiction. For any drug abuse, नशा का जो लत लगता है ना, for any drug abuse, Dr. Vinay, I will explain you, don't worry, okay? So see here now, for any drug abuse, addiction is because of dopamine. याद रहेगा? Okay, fine. So basically, I can say that what are the functions of dopamine? Dopamine is responsible for kick, for reward, for pleasure, for addiction. Serotonin, please write down. Serotonin is responsible for Good food. Yes, very good, Dr. Rahul Singh Rathore. Serotonin is responsible for good food, good mood, and good sleep. Please write down. Serotonin is responsible for good food, good mood, and good sleep. And good sleep. Okay? Good food, good mood, and good sleep. So that's why serotonin is called as happy hormone. That's why serotonin is called as happy hormone. Happy hormone. Serotonin is called as happy hormone. Happy hormone. Okay, it is responsible for good food, good mood, and good sleep. Good food, good mood, and good sleep, right? Okay, fine. Very easy to understand. इतनी बात समझ में आ रही? चलो fine. Now here we are going to learn about some clinical aspect. ये जरा बताना मुझे. See, अब ये जरा बताओ मुझे. चलो ठीक है, अब जरा ये बताओ. Suppose if there is a Suppose if there is a 21-year-old female. Suppose if there is a 21-year-old female. What she's complaining is, sir, I'm not feeling good. For last 1 month, I stay very, very sad. I'm not happy. I'm not sleeping well. I'm not eating well. So do you think there is a deficiency of serotonin? Answer me yes or no. Answer me yes or no. Deficiency of serotonin, yes. So do you think her case is a depression? Her case is a depression? Yes. है ना, डिप्रेशन में lack of food, lack of mood, lack of sleep होता है ना. So do you think in depression there is a deficiency of serotonin? So do you think in depression there is a deficiency of serotonin? Yes. So do you think to treat the depression I can increase the level of serotonin? Answer me yes or no. Yes, very good. So that's why to treat depression we have to give SSRI. What is the full form of SSRI? Full form लिखो जल्दी से all of you. Selective serotonin reuptake inhibitor. Selective serotonin reuptake inhibitor. When I talk about a reuptake inhibitor, what does it mean? See here, amount of serotonin will be increasing or decreasing? reuptake inhibitor है तो increase करेगा decrease करेगा? Yes, देखो reuptake inhibitor means what? रीअपटेक इनहिबिटर मींस व्हाट? नहीं नहीं नहीं, ये इंक्रीज करेगा ना. रीअपटेक इनहिबिटर देखो, ये साइनेप्टिक गैंग्लियन है, साइनेप्टिक क्लेफ्ट है. ओके, तो यहाँ पे क्या होगा? बहुत सारा सेरोटोनिन बनेगा यहाँ पे. ओके, सो हियर देयर विल बी व्हाट? मैन्युफैक्चर ऑफ सेरोटोनिन एंड दिस विल बी रीअपटेकन. सो इसी को अगर रीअपटेक इनहिबिट कर दिया जाए, ब्लॉक कर दिया जाए, सो नाउ देयर विल बी मोर सेरोटोनिन. नाउ देयर विल बी मोर सेरोटोनिन. सो व्हेन आई से reuptake inhibitor, it means it will increase the level. It will increase the level. When I say antagonist, then it will decrease the level. I hope all these points are clear to you. ठीक है? So whenever I give SSRI, okay, see here. So whenever I give SSRI, Dr. Wimblish, okay, that part will come. Okay, so don't worry about that. See, SSRI, very less risk of suicidal tendency, less. Okay, so that is actually a reverse, actually it's a negative feedback. Okay, fine. So please write down. So that's why these days SSRI is the drug of choice for depression. Please write down. SSRI is the drug of choice for depression. SSRI is the drug of choice for depression. Drug of choice for depression. Now, without seeing the notes, I hope your pharmacology is over. So can you give me some examples of SSRI? Bolo, all of you. All of you. अरे पहले से लिख के रखा सबने. अच्छा, फार्मा नहीं हुआ अभी, कोई बात नहीं, एमबीबीएस में तो हो गया होगा ना, थोड़ा बहुत तो याद होगा. थोड़ा बताओ, थोड़ा थोड़ा. ओके, नो प्रॉब्लम, हो भी जाएगा, फार्मा भी हो जाएगा, डोंट वरी, हो जाएगा फार्मा. ओके, प्लीज राइट डाउन सम एग्जांपल. देखो, आई विल कीप ऑन राइटिंग सम ड्रग्स. Please write down in a separate page. You have to memorize. See here, you have to memorize all the drugs, all the medicines, because 5 questions from psychopharma. Keep in mind, 5. I'm saying 5. Okay, chalo, write down. See, I'm writing 5 SSRI name. Please write down. I'm writing 5 SSRI name. 5 SSRI लिख लो. सबसे पहले लिखो फ्लूऑक्सेटिन. लिखो फ्लूऑक्सेटिन. लिखो फ्लूऑक्सेटिन. After that, write down sertraline. Sertraline. After that, write down escitalopram. After that, write down dapagliflozin. Please write down, all of you, dapagliflozin. After that, write down paroxetine. I have written here 5 SSRI. I have written here 5 SSRI. Please do not forget these 5 SSRI. Do not forget these SSRIs, I am telling you. Pura, without seeing the notes, ratta marna, ratta, memorize it 100%. It should always be on the tip of your tongue. This much important. 5 SSRI: fluoxetine, sertraline, escitalopram, dapagliflozin and paroxetine. Dapagliflozin and paroxetine. याद रहेगा सबको? Dapagliflozin and paroxetine. Fluoxetine, sertraline, escitalopram, dapagliflozin and paroxetine. Dapagliflozin and paroxetine. Okay, chalo, fine. I hope all these points are clear to everyone. ठीक है, लिख लिया पूरा? चलो, very good. That is citalopram is nothing but escitalopram, Dr. Bharat, है ना? वो same है वो. Escitalopram, citalopram, same thing. Okay, चलो, fine. Dr. Bharat, okay, चलो, fine. ठीक है. Now, next is norepinephrine. Please write down. Norepinephrine is responsible for alertness and arousal. Alertness and arousal. Please write down. Norepinephrine is responsible for alertness and arousal. Alertness and arousal. Alertness and arousal. Okay. So now my question is that I had a patient, this same patient. I had the same patient who was suffering from depression. I started my patient. So basically, see here, I started my patient on SSRI, but she did not respond that much. She did not respond that much. ठीक है, वो क्या करेगी सर? मूड तो ठीक हो गया है, ओके, समवॉट बेटर, बट आई डोंट वांट टू बिकम डॉक्टर. आई डोंट वांट टू पास एमसीआई. नहीं करना मेरे को कुछ. नो 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 नो, नहीं डॉक्टर, नहीं डॉक्टर साहब, नहीं, नो यार, नो यार, आई डोंट वांट टू डू एनीथिंग यार, लीव इट. इसका मतलब क्या हो रहा है? Mood is fine, but now there is still lack of energy, lack of motivation. So what does it mean? Deficiency of norepinephrine also. Serotonin to tha hi. Norepinephrine is also deficient. So do you think along with serotonin, I should be increasing the level of norepinephrine also? Do you think so? So do you think I can give her SNRI? SNRI? Serotonin and norepinephrine reuptake inhibitor. Do you think so? Yes. Yes. So can you give me some examples of SNRI? Bolo example. Venlafaxine. Very good. Please write down. See, I will be writing only 2 drugs name. Venlafaxine and desvenlafaxine. लिख लो. Duloxetine also, but write down only 2. Venlafaxine, desvenlafaxine. Desvenlafaxine. Please write down. Please write down. Venlafaxine, desvenlafaxine. Venlafaxine. लिखो. ठीक है, एक और लिख लो यहाँ पे. Duloxetine also. Duloxetine. Please write down. You have to memorize the name of these drugs. You have to memorize. लिखा? चलो fine. So without seeing the notes, can you tell me 5 SSRI names? See, all of you, without seeing the notes, can you tell me 5 SSRI? शॉर्ट फॉर्म में लिखो, शॉर्ट फॉर्म में लिखो, जल्दी जल्दी लिखो। फ्लोक्सेटिन, सी विदाउट सीइंग द नोट्स, फ्लोक्सेटिन, sertraline, escitalopram, depoxetin, and paroxetine. Paroxetine. Very good. Now, so can you tell me the name of SNRI? Bolo. SNRI का name बोलो. वेंलाफैक्सिन, डेसवेंलाफैक्सिन. देखो वेंलाफैक्सिन, डेसवेंलाफैक्सिन हमेशा याद रखो, वेरी वेरी इंपॉर्टेंट. वेंलाफैक्सिन, डेसवेंलाफैक्सिन and duloxetine. The question is that how examiners are going to frame the question, how examiners are going to integrate it clinically. Overall drug of choice for depression is SSRI. Overall drug of choice for depression is what? SSRI. But when will you take a decision to start a patient on SNRI and not SSRI? Huh? Please write down. Whenever patient is having, see here, so what are the indications? Please write down. What are the indications of starting a patient on SNRI? So whenever patient is having lack of energy, lack of motivation, okay, and a lack of drive, Yeah, Dr. Safa, yes. है ना? So basically, suppose see, देखो, suppose only SSRI is not working, then you can start SNRI. But what are the indications? What should be the symptoms in the patient that you can see the patient, and after that you can take a decision that you have to start on SNRI? क्या होना चाहिए? When patient is having no energy, no motivation, no drive. When a patient is saying, "What, I don't want to do anything. I don't want to become a doctor. I don't want to achieve anything. I don't have any ambition. I don't have any dream." At that time, SNRI is needed. At that time, SNRI is needed. समझ में आ गई बात? Very easy to understand. I hope all these points are clear to everyone. ठीक है. Now acetylcholine. Okay, acetylcholine. Doctor, you are asking, sir, can I take it for FMG exam? Answer is no. No, please, no. No. नहीं, देखो, I will teach you कौन सा दवा यूज करना. See which medicine to be taken before the exam. I will teach you. Don't worry. Okay, don't worry. ये सब no, 100% no. No, no. Answer is no. Okay, now what about acetylcholine? What about acetylcholine? Acetylcholine. Acetylcholine. See, whenever, see here, after the break, whenever you smoke a cigarette, after the break, whenever you smoke a cigarette, see, देखो, like suppose if a teacher is taking class, है ना? Whenever you are taking long class, after that you are dull, you are having lack of energy, lack of motivation. When you feel lack of energy, after that, during the break, when you smoke cigarette, tea, coffee, but especially when you take cigarette, after that, when you come back to class, you are having good energy, good attention, good concentration, good judgment power. Okay, you do not smoke, very good, अच्छी बात है. टी कॉफी whatever. So basically बताओ सिगरेट में क्या होता है? निकोटिन. सिगरेट में क्या है? निकोटिन. In cigarette there is what? Nicotine. In cigarette there is nicotine. Please write down. Nicotine will stimulate two neurotransmitter. One is a dopamine. One is acetylcholine. Because of dopamine you are getting the kick. You are getting the kick, that energy. Because of acetylcholine, you are getting good attention, good concentration. Dr. Abhishek, yes. What depression है बेटा वो? ठीक है? Okay, fine. So please write down. After taking cigarette, after smoking a cigarette, you will be having what? Good attention. Write down. Good concentration. Good judgment power. Good learning power. Good mathematic ability, good memory also, good memory power also, good attention. After smoking a cigarette, yes, doctor, yes, after smoking a cigarette, you will be having good attention, good concentration, good judgment power, good learning, good memory, good mathematic ability. What does it mean? Cigarette is good. I was teaching the same thing somewhere in Kyrgyzstan. ठीक है। सो बिश्केक में कहीं क्लास लिया था मैंने, ठीक है? तो ऐसे बोल दिया मैंने मस्ती में, सर सी दिस वाज आउट ऑफ सरकाजम, ओके, आउट ऑफ सरकाजम। ठीक है, मैंने ऐसे बोल दिया था कि इट मीन सिगरेट इज गुड। सो ड्यूरिंग द ब्रेक वन स्टूडेंट केम एंड ही टोल्ड मी, सर बिकॉज ऑफ यू आई स्टार्टेड इट अगेन। मैंने बोला अरे बेटा, फिर मुझे बोलना पड़ा, आफ्टर स्मोकिंग अ लॉट यस यू कैन हैव लंग कैंसर, जीआईटी कैंसर, थ्रोट कैंसर, यूरोजेनिटल कैंसर, मोस्ट ऑफ द कैंसर, 50% ऑफ द ट्यूमर्स आर बिकॉज ऑफ निकोटिन, निकोटिन बिकॉज ऑफ द टोबैको, टोबैको, टोबैको। ठीक है, समझना, इजी टू अंडरस्टैंड, सो प्लीज राइट डाउन। सर मॉम इज आस्किंग, सर कौन सा सब्जेक्ट ले रहे हैं? अरे बताओ, देखो सुनो, आई फील सम पेरेंट्स आर आल्सो सिटिंग, तो आई एम टीचिंग सब्जेक्ट, this is psychiatry, we have to learn about neurotransmitters. I think I was taking class, I think during the pandemic, right? I was teaching about substance abuse. I was teaching about substance abuse. So one student asked me, substance abuse है भांग, गांजा, hashish, alcohol. We have to learn, obviously, we have to learn about bhang, ganja, hashish, alcohol, so that we have to see the patient. Right? So one student asked me, sir, which one is the most potent drug? आई सेड बेटा अभी रुक जाओ, अभी पढ़ाने दो, मैं बताऊंगा सस्ता नशा, महंगा नशा, कौन सा दुकान कहाँ पे मिलता है. सो दैट वाज आउट ऑफ sarcasm, and I think so, like, I think so her mom was also sitting there and she told her, what kind of teacher you have, ये भांग गांजा हशीश पढ़ा. So I so I had to say, right, this is subject, understand all drug abuses first of all. So first of all, we have to understand all the drugs, after that patients, after that side effects, after that how to de-addict, how to start the medicine. Chalo, okay, fine. I hope all these points are clear. So A for attention, C for concentration, J for judgment power, learning power, mathematic ability, and what? Memory ability. Mathematic and memory ability. Very easy to understand, right? So all these are because of what? All these are because of what? Acetylcholine. All these are because of what? Acetylcholine. Very easy to understand, right? Chalo, okay. Dr. Anil, yes, it is happening. अब देखो मेरा दोनों सब्जेक्ट ही ऐसा है यार, साइकेट्री फॉरेंसिक में सारे टॉपिक्स आएंगे ना, वी हैव टू लर्न ऑल दिस टॉपिक्स, राइट? एंड सेक्सुअल टॉपिक्स विल बी देयर, ड्रग अब्यूज विल बी देयर, बट वी हैव टू लर्न, राइट? Chalo, fine. So I hope all these points are clear to all of you. Now, without seeing the notes, all of you, please write down how many most important neurotransmitters I have taught you. Four का नाम लिखो जल्दी, short form में लिखो, without seeing the notes. All of you write down. All of you. Yes, dopamine, serotonin, norepinephrine, acetylcholine. So without seeing the notes, can you tell me which neurotransmitter is responsible for the kick? Bolo, for the kick. Dopamine. Happy hormone, bolo, happy hormone. Serotonin. Which one is responsible for alertness and arousal? Norepinephrine. Which one is known as attention hormone, bolo? Attention hormone. Attention hormone, acetylcholine, right? Attention, है ना? Acetylcholine. So whenever a person is having disorientation to time, place, and person, which neurotransmitter problem bolo? Disorientation to time, place, and person, lack of attention, lack of concentration, which neurotransmitter? Acetylcholine. Simple logic हो गया ना? इसी तरह से बताओ, same thing we can apply. One more correlation in dementia. Dementia में कुछ प्रॉब्लम होता है, कुछ पढ़ा होगा आपने, किसका प्रॉब्लम होता है? आउट ऑफ दीज 4 न्यूरोट्रांसमीटर्स, डिमेंशिया में यस एसिटाइलकोलिन, यस एसिटाइलकोलिन, एसिटाइलकोलिन, Please write down. In dementia, there is degeneration of neurons producing acetylcholine. Degeneration of neurons producing acetylcholine. Please write down one more function of acetylcholine. One more function of acetylcholine. It enables muscle action. It enables muscle action. Please write down. Write down. All these points are clear to everyone. I hope so. See, what is the one more function of acetylcholine? It enables muscle action also. Muscle action also. And in Alzheimer's, yes, please write down. In Alzheimer's, degeneration of acetylcholine. Okay, chalo, fine. सर फुल फॉर्म बता दो अच्छी वाली. फुल फॉर्म तो बता दिया ना. ओके फाइन, चलो अब आ जाओ क्वेश्चन पे आ जाओ. acetylcholine. Okay, that was acetylcholine. Okay, acetylcholine. Yes, now answer is what? Dopamine and acetylcholine. Dopamine and acetylcholine. ठीक है, चलो फाइन, वेरी गुड वेरी गुड. चलो इतनी बात सबको समझ में आ गई. चलो फाइन, देयर आर सम क्लासिफिकेटरी. डॉक्टर गोथुला सा, yes, some memory pills, yes, I will give you, don't worry. जब भी क्लास में we will learn everything, don't worry, we will learn everything. ठीक है, how to prepare, what to prepare for next 40-50 days, I will teach you everything, right? Dr. IS, yes. Now there are some classificatory systems in psychiatry. ICD full form लिखो जरा. ICD full form, see, International Classification of. सर घर आ जाओ एग्जाम तक. अच्छा मिलेंगे बेटा, मिलेंगे सब लोग. ओके, लिखो जरा. ICD full form, International Classification of Diseases. International Classification of Diseases. Dr. Abhishek, like example of schizophrenia and mania. Dr. Abhishek, mania and schizophrenia. See, International Classification of Diseases. Okay. Edition number 11th. See, it was given by WHO. डॉक्टर मैंक जैन, लास्ट वाले नोट्स में से मैंने कुछ हटाया, मैंने थोड़ा और शॉर्टकट किया है, तो ये वाले नोट्स में थोड़ा मैंने हल्का सा वो कट डाउन किया है. ओके, ICD-11 देखो. See, this was given by WHO. This was last time, this was implemented on 1st January 2022. 1st January 2022. And please write down as ICD-11, all diseases of all departments are given here. All diseases of all departments are given, like surgery also, obs gynae also, ENT also, ophtha also, psychiatry also. Please write down. Psychiatric diseases are given in 6th chapter. 6th chapter. ICD full form, International Classification of Diseases. International Classification of Diseases. Okay, now DSM full form, please write down DSM full form. These are classificatory systems in psychiatry. Okay. DSM, please write down diagnostic and statistical manual. Edition number 5. Edition number 5. Dr. Abhishek, yes. See here, like in ICD-11, diseases of all the departments are given in all other chapter, 1st chapter, 2nd, 3rd. So in 6th chapter, all psychiatric disorders are given. Psychiatric disorders are given. Please write down DSM-5, Diagnostic and Statistical Manual, 5th edition. So this is given by American Society of Psychiatrists. This is given by American Society of Psychiatrists. Only psychiatry department. So here, only psychiatry only psychiatric classifications are given, only psychiatric disorders are given. Last time this was implemented in 2014 actually. Okay, 14. See, we have to follow both classification, ICD-11 also and DSM-5 also. But which one is most updated? Which one is most updated here? Most updated is ICD-11. DSM-5. See, DSM-5 is given by American Society of Psychiatrists, but we have to follow both. We have to follow both, right? So remember here, there are some updates in ICD-11, which I will keep on teaching you as per the chapters. Some updates are there, which I will teach you. We can anticipate one question from the update. Please write down here. Please write down here. ICD-11 and DSM-5. Both have classified psychiatric disorders on the basis of signs and symptoms. On the basis of signs and symptoms only. So there is one more classificatory system now. There is one more classificatory system now. So they are saying that ki bhai, chalo, only on the basis of signs and symptoms you have classified all psychiatric disorders. But how can you ignore blood test? How can you ignore how can you ignore the biological variation? How can you ignore the genetic relation, right? So now there is one more classificatory system. Research domain criteria. They have classified disorders on the basis of signs and symptoms with neurobiology. Please write down, very, very important. With neurobiology also, blood test also they want to do. They want to correlate with the neurobiology also, the genetic variation also. I have taught you 3 classificatory systems now: ICD-11, DSM-5, and RDoC. I hope all these points are clear to everyone. Now, without seeing the notes, please write down 5 SSRI. Bina dekhe wo answer karo. Without seeing the notes, please write down in chat box, all of you. 5 SSRI likho. Short mein likho. Short form mein likho. Fluoxetine, sertraline, escitalopram, dapagliflozin and paroxetine. ओवरऑल मोस्ट कॉमन जो यूज होता है ना वो फ्लूऑक्सेटिन है. मोस्ट कॉमन जो यूज होता है ना वो फ्लूऑक्सेटिन है. फ्लूऑक्सेटिन मोस्ट कॉमन. ओके, नाउ प्लीज राइट डाउन द नेम ऑफ एसएनआरआई. लिखो एसएनआरआई. प्लीज राइट डाउन एसएनआरआई. कोई बात नहीं, स्लो लिखो बट शॉर्ट फॉर्म में लिखो. डॉक्टर सौरभ. वेनिलाफैक्सिन, डेसवेनिलाफैक्सिन, duloxetine. अच्छा बताओ, what is the function of norepinephrine? बताना जरा, what is the function of norepinephrine? Alertness and arousal. Alertness and arousal. ठीक है, alertness and arousal. Very good. ठीक है, इतनी बात काफी है. चलो, very nice. I can understand that you people are able to understand all these questions. ठीक है, सबको समझ में आ रहा है? अब लिख लो यहाँ पे, who coined the term psychiatry? Who coined the term psychiatry? Please write down. Who coined the term? Yes, John. लिख लो यहाँ पे, John. Very good. Christian Ryle. ये वर्ड इंपॉर्टेंट है. Who coined the term? हाँ, याद करना है, ये भी याद करना है. See, देखो, these days mostly these kind of question they are not asking, but मुसीबत पूछ के नहीं आती है ना. लिख लो, है ना, याद तो रख लो. जॉन क्रिश्चियन रायल. Who coined the term psychiatry? Psychiatry term was given by John Christian Ryle. So Johann actually, John. John Christian Ryle. Okay, John Christian Ryle. ठीक है, John Christian Ryle. Easy to understand. सिर्फ एक वर्ड याद रखो, John Christian Ryle. Who coined the term? Okay. Now my question is that how to assess a psychiatric patient? Suppose if you are getting a patient. Okay, suppose if there is a 19-year-old female wearing jeans and top. ये jeans and top mention करना जरूरी है क्या? Do you think mentioning jeans and top is necessary or not? Yes, it is important. Yes, it is important. It is important. Why? See, because external appearance is important. So you have to see higher socioeconomic status and lower socioeconomic status. Now, she's complaining that, sir, for last 1 month, I'm not feeling good. I'm not eating well. I'm not sleeping well. I'm having negative thoughts. I'm having suicidal thoughts. Basically, क्या है? She's suffering from depression. She's suffering from depression. Now, how to assess a psychiatric patient? See, देखो, psychiatric patient को कभी भी अगर वो करना है ना, सर नो प्लेस टू राइट इन पीडीएफ, तो आप साइड में कहीं पे लिखो, सेपरेट पेज लगा लो, लिख लो. Okay, separate page you can keep. So see here, always keep in mind history taking most important, and then clinical examination. History taking. Suppose if anyone, see here, anyone who wants to be psychiatrist, like so many students are here, anyone who wants to be a psychiatrist here, you have to be a good speaker. You have to be a soft spoken person. You have to take a good history. You have to make your patient very, very comfortable. So the question is that, ये बताओ, ये जो question है, ये वाला जो question है ना, ये जो case है, 19-year-old female, mostly she is suffering from depression. My question is that, Dr. Gayatri, very good. Yes, okay, all of you, very good. है ना? So what are the relevant questions you are going to ask? What are the relevant questions you are going to ask? Please write down all the questions, whatever you want to ask. Suppose you are a psychiatrist now, whatever question you are going to ask, please write down. I'm sure most of you don't want to be psychiatrist. Right, na? सिंगल है, पेरिनेटल है, अच्छा ठीक है, लिखो लिखो लिखो, हम तो पेशेंट हैं. ठीक है, चलो, you have written so many things. So what are the relevant questions? देखो, सबसे पहला, first question, since she is a girl, always start asking with menses. Always start asking with menses. है ना, कि menstrual cycle normal है, abnormal है, because 7 days before menses, there will be what? There will be fluctuation of hormone. So there can be what? Fluctuation of emotion. So there can be mood swings. After that, ask about her obstetric history. Ask about obstetric history. Obstetric history, उससे पूछो आपकी पैदाइश कहाँ पे हुई थी. Ask the patient where your delivery happened, at home or in hospital. Because remember here, 64% Indian population, they are living in villages. And still I'm telling you, so many deliveries are being performed by dai. है ना, dai. So obviously there can be risk of injury. No? है ना? Please write down, obstetric complications can lead to schizophrenia in future. Obstetric complications can lead to schizophrenia in future. So during the delivery, if there will be any complications, yes, it can lead to psychiatric disorder. Dr. Rahul Ilango, you don't know about DAI? A village worker who assists in delivery, actually, right? Village worker. I think midwife, you can say, like that, okay? Yes, obstetric complication. After that, ask about her emotional status. Ask about her emotion. देखो, psychiatry में emotion and relationship status, very, very important. आशा वर्कर समझ सकते हो. यस, आशा वर्कर टाइप में होते थे वो लोग ना, आशा वर्कर, आज भी वही होते हैं, दाई अम्मा लोग, ठीक है. सो सी हियर, इन एनी साइकेट्रिक प्रॉब्लम, आस्क अबाउट रिलेशनशिप स्टेटस. हो सकता, देखो 19-year-old हो सकता, माइट बी ब्रेकअप, है ना, तो इमोशनल प्रॉब्लम हो सकता है, राइट. नो, हाउ टू आस्क इमोशनल, यार मतलब खुश हो, दुख हो, क्या है. तो बेसिकली यू हैव टू असेस इमोशन, रिलेशनशिप प्रॉब्लम मोस्ट इंपॉर्टेंट, ओके. नो, आफ्टर दैट आस्क अबाउट her history of childhood, है ना. What kind of child she was? She was allowed to play with other kids or not? Suppose if a child is being discriminated by other kids, so do you think that child can develop fear of rejection? Yes, fear of rejection. After that, any kind of abuse. After that, any kind of abuse, physical abuse, sexual abuse, family abuse, right? No, family abuse, right? After that, ask about educational status. Ask her, are you a medico? पूछो उससे, आर यू डूइंग एमबीबीएस? हाँ, एमबीबीएस तब तो पक्का ठीक है, 100% डिप्रेशन, ओके है ना. एजुकेशन लेवल इज इंपॉर्टेंट, राइट? नो, सो ऑल दीज, सो व्हाट काइंड ऑफ क्वेश्चन दे आर फ्रेमिंग? देखो, एम्स क्वेश्चन है, दिस वाज ओल्ड एम्स क्वेश्चन. ऑब्वियसली फूड ना, फूड देखोगे ना, फूड देखो यहाँ पे मतलब पास्ट हिस्ट्री है, फैमिली हिस्ट्री, यस है ना. तो फूड देखो, वेज नॉन वेज से डिप्रेशन का क्या लें, तो इसी में ऐड कर लो यहाँ पे. आस्क अबाउट फैमिली हिस्ट्री ऑल्सो, ask about marital history also, marital history also, okay. Ask about past history also. तो marital history, divorce हो सकता है, divorce है, या फिर मान लो कि marital history is actually not healthy, right? Easy to understand. ठीक है, चलो फाइन, वेरी गुड, है ना जी. इसके अलावा लिखो यहाँ पे सब्सटेंस अब्यूज, सब्सटेंस अब्यूज भी लिखो, सब्सटेंस अब्यूज. वर्क में लिख लो, वर्क. डॉक्टर इम्तियाज, हाँ 19 में भी हो सकता है ना, शादी का मतलब 18 एज है ना, तो 19 में हो सकता है, क्यों नहीं हो सकता है? बेसिकली यू हैव टू आस्क ऑल दीज क्वेश्चंस, ठीक है. चलो फाइन. Now, next question, see, history taking we have completed. Now, the most important thing is that whenever you take history, history taking में क्या होता है? Most important is reliability and adequacy. देखो, see here, as per Indian population, no, most of the people, most of the doctors, they don't want to take psychiatry as a specialization field. And see here, like whenever I visit my village, I never tell anyone that I am having any relation with psychiatry. I will say कि हाँ मैं डॉक्टर हूं बस. गांव में बोलोगे तुम किसी को साइकेट्री, तो वो तुमसे भागेंगे. Most of the people will run. See, yes, so most of the people will think that you are a psycho. उनको क्या लगेगा, तुम ही साइको हो. होता है नहीं, देखो ये सोशल स्टिग्मा है, बेसिकली सोशल स्टिग्मा है ना. सो लाइक सी हियर नाउ, in India, people will be happy if they get only TB, only typhoid. Kuch ho gaya, okay, fine. But if anyone who is having depression, anxiety, or any psychiatric, so they will be very, very uncomfortable. They don't want to talk about this, right? So psychiatric issue, no one wants to talk. क्योंकि ये थोड़ा social stigma है, right? Most of the time, patients do not want to come, है ना. अगर वो आया भी ना, तो patient will never come alone. Patient will always be accompanied by someone. So there will be a patient, there will be a patient, and there will be one informant. There will be one informant, है ना. या तो वो friend होगा, family member होगा, roommate होगा. So we have to assess both. Patient को भी see, sometimes patient will be speaking a lot, sometimes patient cannot speak anything. So at that time we have to speak with the informant also, family member हो या जो भी हो. So question क्या पूछा जाता है? What are the rules? Every time related to patient, first these three. Every time a story should be same. See, देखो here ना, so we call the patient for 5 cycles, 6 cycles, 8 cycles. ये cycle क्या है? Cycle means what? उनको आना है. Cycle means what? Like they have to come for counseling. They have to come for counseling. Every time a story should be same. So there should be consistency. It should be logical. And there should be continuity. Okay, sir, first of all, I stopped eating, then I stopped speaking, then I stopped sleeping, right? Yes, Dr. Poonam, yes. After that, I have to see the informant. I have to see the informant also. मुझे अब informant को देखना है. Remember here, first of all, I have to check how much he is actually close with my patient. How much actually he is concerned for my patient. Duration of stay. Educated informant will be having better observational skill. Now tell me, suppose if I'm a psychiatric patient, I was living with my roommate for last 6 months. For last 6 months. My brother, my family members, they are living in USA, Chicago. And we meet once in 4 year, 5 year, after 2, 3 years. See, in my case, suppose if I'm going to visit any psychiatrist, who will be better informed, my brother or my roommate? Roommate, suppose if my roommate is also a doctor, he will be having better observational skill, right? So can you solve this question now? Solve this question, all of you. Solve this question now. See, देखो इसमें रूल आउट करना है आपको, रूल आउट करो. Yes, in this question I can rule out this. See, in this question I can rule out this. ठीक है? I can rule out biological relationship. Having said that, you have to be very much careful about the sentence of the question. Suppose if examiner is mentioning any family member here. Suppose if there is a mother with a 5-year-old baby. Now, in this question, which one you can rule out? Educational status. See, in this case, biological relation will be important. समझ में आ गई बात? So you have to see the question, and as per the question, you have to rule out. As per the language of the examiner, you have to rule out. This is an important question. Old FMG question, I'm telling. Old FMG question aa chuka hai. See, all the questions whichever I'm asking you, these are old questions only, right? Now, second step is clinical examination. How do we do clinical examination here? Dr. Ahmed Nazir, can you explain the last example? Biological relation, no? Biological relation here, no? See here, so that time educational status will be better important, no? So that will be more important because see here, suppose if the informant is more educated, he will be having better observational skills, okay? MMSC, you are writing? See, in this question, as per the question, answer is a D. As per the question, answer is D here, as per the question, okay? Chala, fine. See here, MSc means mental status examination. Mental status examination. MMSc means what? Mini mental status examination. Mini mental status examination. अब बोलो क्या है? Clinical examination of a psychiatric patient is done by. Answer is write down D. D. Mental status examination. But you will be asking कि sir mini मतलब micro examination of mental status. Why MMSc है? Dr. Saurabh, we are asking the same thing, no? Please write down. MMSc is for organic mental disorder, where you have to go into detail. MMSc is for organic mental disorder. Overall, for the psychiatric disorder, clinical examination is called as what? Mental status examination. Easy to understand. I hope all these points are clear to everyone. समझ में आ गई बात? Now, without seeing the notes, can you tell me who coined the term psychiatry? Please write down in chat box. Write down in chat box who coined the term. John Christian Ryle. John Christian Ryle. Which neurotransmitter is responsible for kick? बोलो जल्दी से लिखो. Fast, fast, fast. Which is responsible for kick? Dopamine. Which is responsible for happiness? बोलो जल्दी से. Happiness. Serotonin. Alertness and arousal बोलो. Alertness, arousal. Norepinephrine. And what about attention concentration? Acetylcholine. सिगरेट पीने के बाद क्या बढ़ेगा? सिगरेट के बाद dopamine and acetylcholine. Okay, so can you tell me some other synonyms of mental confusion? OMD means organic mental disorder. Organic mental disorder. ठीक है? So what are the other synonyms of mental confusion? Disorientation to time, place, and person. Altered sensorium, and clouding of consciousness. Clouding of consciousness. Okay, so for now we are going to learn all mental status examination one by one. See, these are the components of mental status examination. Please write down. Every time, first of all, you have to see general appearance. This is important for what? Socio-economic status. Socio-economic status. Look at the eyes of the patient. 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 See, suppose every time a patient is looking downward, then what is the diagnosis? Depression. वो सर आंखें नीचे झुका के बात कर रहा है. That is called about depression. Suppose a patient is looking here and there. Suppose a patient is looking here and there, इधर उधर, here and there. Then answer is what? Anxiety. Anxiety. Suppose if patient is having poor eye contact, then answer is what? Autism. Autism. Very good, Dr. Safa, Dr. Pratiksha. So see here, so these are diagnoses we can make only after the general appearance, only as per the eyes movement, and only as per the eyes movement. Very easy to understand, right? No, very easy, right? Now, speech. Suppose a patient is speaking a lot. Suppose a patient is speaking a lot, then he is suffering from mania. Suppose a patient is not at all speaking, that is called as what? Depression. Depression. After that, write down one more word. Prosody. Please write down this word. Emotion of speech. Emotion of speech. See, emotion of speech is called the prosody of speech. Emotion of speech. Same word, different meaning. Please write down क्या होता है emotion of speech का मतलब क्या हुआ? Same word but different meaning. Same word, different meaning. That is called the prosody of speech. That is called what? This is called a prosody of speech. मतलब emotion of speech. Have you seen that movie? PK movie देखा था PK? इसमें आमिर खान like he will be in jail when he will be talking with Anushka Sharma. And उसमें नहीं बोलता कि अच्छा. Same word, different expression, different meaning. है ना? Right? अच्छा. Same word, different meaning, different expression. That is known as the prosody. सारे word याद रहेंगे. That is called the prosody. That is called the prosody of speech. Okay, prosody of speech. Okay, chalo fine. I hope all these points are clear to everyone. ये wrong number है, right? Wrong number है. Chalo fine. Next word is what? Mood and affect. हाँ, Dr. Swaroop. Okay, fine. Now, mood and affect means what? See, they describe emotion. Mood and affect describe emotion. Please write down. Mood and affect, they describe emotion. So please write down. Depression is an example of mood disorder. Please write down. Yes, very good, Dr. Vishal, Dr. Imtiaz. Okay, mood and affect means what? Emotion. So what does it mean? Depression is an example of mood disorder. Next word is the perception. How do we perceive anything? How many senses do we have? 5. Visual, auditory, olfactory, taste or gustatory, and this will be touch, tactile, right? Okay. See, suppose there is nothing but you can see something. That is called a what? Visual hallucination. Suppose if you can hear something which other people cannot, that is called a what? Auditory hallucination. Okay. Suppose if you are going to use a public toilet, especially in India, especially at the railway station, washroom jo hote hain, railway station, ammonia, very bad smelling, no? So after using a public toilet of railway station, suppose if a person is saying, wow, what a fragrance here, man. क्या मतलब हुआ? Olfactory problem. सूंघने में, olfactory, right? Okay, suppose if a person is taking gulab jamun, sweet dish, gulab jamun, after saying, yeah, salty, right? What does it mean? Gustatory, taste, gustatory. Suppose if a person is a cocaine abuser, suddenly he starts what itching. Okay, like itching is, oh my god, under my skin, some bugs are there. That is called a what? Tactile hallucination. Please write down. I can say that hallucination is a disorder of perception. Hallucination is a disorder of perception. Next word is a thought. Next word is thought. Please write down. Delusion is a disorder of thought. Delusion is a disorder of thought. Delusion is a disorder of thought. Please write down. Higher mental functions में लिख लो. Attention, concentration, judgment power, right? Memory power. These are what? Higher mental functions. Okay? Attention, concentration, judgment power, and memory. Now you will be asking me, sir, what about this word? You did not explain about this word. You did not explain about the cognition. Ye batao, what is the meaning of this word? Can you answer me? What is the meaning of cognition? What is the meaning of cognition? Bolo, what is the meaning of cognition? Dr. Venkat. Okay, chalo, fine, very good. All of you are doing very good. See, so please write down. See this word. When I talk about this word, when I talk about cognition, please write down. This is a broader term by which we are learning something. See, by which we are learning something like memory, speech, behavior, action. Behavior means action, or behavior means action. Memory, speech, behavior, and most important word is thought. Most important word is thought. Remember here, see here, all these we see in the cognition only, thought, even mathematic ability, even orientation, all these are the components of cognition. Whenever you are learning in neuromedicine, so many times doctor will be using this word, so many times faculty will be using like this, no, decline in cognition, decrease in cognition, or disorientation to time, place and person. Means what? वही तो हो गया ना, orientation का उल्टा disorientation हो जाए, means there is some problem in cognition. Very easy to understand. My question is that if you have a patient after head injury, so do you think there can be memory loss? Yes, there can be amnesia. Amnesia means memory loss. After head injury, do you think there can be a loss of speech? Yes, there can be aphasia. Aphasia or alogia. Both are same thing. Aphasia or alogia, both means what? Loss of speech. Ab bologe sir, then what is the difference? Aphasia means what? Whenever there will be anatomical damage. Alogia, loss of speech, psychological. Alogia, psychologically mute. Suppose If a person is psychologically mute, उसको बोलते हैं अलोगिया. अलोगिया, राइट? वेरी गुड, अलोगिया. ठीक है. आफ्टर हेड इंजरी, after head injury, do you think there can be what? A loss of action also? So do you think a person can forget how to button the short, how to drive the car, how to do any work, how to comb hair, right? No, loss of action is called as apraxia. Loss of action is called as apraxia. Loss of action is called as what? Apraxia. After head injury, yes, it can also be possible that a person may not be able to do mathematical calculation, right? That is called as acalculia. Acalculia means what? Inability to do mathematical calculation. Please write down. जिसको नहीं आता लिखो. Acalculia means what? Inability to do mathematical calculation. A person can also forget. A person will be having what? Inability to understand any stimulus. Inability to understand any stimulus. Okay, that is called as agnosia. Agnosia. Agnosia means what? Inability to recognize any stimulus. See, suppose if I keep my hand on the body of the patient, see, patient can understand. And here patient can understand, okay, this is hand. He can understand. Agnosia means what? Inability to recognize any stimulus is called as agnosia. Agnosia is of two types. Do you think a person can forget his father, mother also? हो सकता है, possible हो सकता है क्या? After head injury, do you think a person can forget his father, mother also? Yes. Amnesia means memory loss. Yes. Inability to recognize a known person. Please write down. Dr. Abhishek, very good. Inability to recognize a known person is called as prosopagnosia. Okay, this is called the prosopagnosia. This is called the prosopagnosia. Okay, right? This is called as prosopagnosia. Sometimes a person can have, sometimes a person may not be able to recognize himself also whenever he's looking into the mirror. Oh my God, who is this guy? See, inability to recognize the self is called as autoprosopagnosia. 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 Please write down all these words. ये सभी कभी कभी ना वन लाइनर क्वेश्चन फिजियोलॉजी में पूछा जाता है. वन लाइनर, so you should know all these, है ना? See, all these terms you should know. See, inability to recognize a known person is called as the, see, this is called as the prosopagnosia. This is called as, this is known as what? Prosopagnosia. Apraxia means loss of action. Loss of action. Loss of action. Where a person is having what? Where a person is finding difficulty in how to button the shirt, how to comb hair, how to drive, right now? So please remember here. Amnesia means memory loss. Aphasia, alogia means what? Loss of speech. Apraxia means what? Loss of action. Acalculia means what? When a person is not able to do the mathematical calculation. What is the meaning of agnosia? Where a person is having what? Inability to recognize any stimulus is called as agnosia. Agnosia, right? Okay, so there are two types of agnosia. One is called the prosopagnosia, then autoprosopagnosia. What is the meaning of the prosopagnosia? Inability to recognize a known person, right? Inability to recognize a known person. Self autoprosopagnosia. अब मेरा क्वेश्चन क्या है, देखो यहाँ पे, see here. See, amnesia, aphasia, apraxia, acalculia, whatever I have written here, and whatever I have written here, my question is that, ये बताओ अब यार, कि suppose if I have a psychiatric patient, who has, who is not able to recognize other people, who is not speaking a lot right now. So now if I am doing behavior therapy to improve his memory, to improve his speech, okay, to improve his action, usko main aise bolta hu, in this manner you have to shake your hand, in this manner you have to button the shirt, in this manner you have to comb the hair, see, in this manner you have to greet any stranger. So basically I am doing behavior therapy to improve the cognition, no? Right now I am doing behavior therapy to improve the cognition. It is called as CBT, likh lo. It is called as CBT, cognitive behavior therapy. Behavior therapy to improve the cognition. Given by which scientist? Aaron Beck. Please write down. Given by Aaron Beck. Aaron Beck. Given by Aaron Beck. Given by CBT full form लिख लो, cognitive behavior therapy. CBT is the most important psychotherapy in psychiatry. I'm saying psychotherapy हो या behavior therapy का क्या मतलब होता है? आसान भाषा में, in the easiest language, it is called the counseling. It is called the counseling psychotherapy. So CBT is one of the most important. CBT full form क्या है? Cognitive behavior therapy. MSc full form क्या था जरा बताना? MSc full form mental status examination. What is the full form of MMSE? Bolo, what is the full form of MMSE? Mini mental status examination. Where do we use MMSE? Can you answer me? Where do we use MMSE? Organic mental disorder. Organic mental disorder. So now you tell me, see, what are the components of MSC? General appearance, speech, mood, emotion, perception, thought, cognition, higher mental function, right? Okay, fine. Now see this question and you try to answer this question. All of you, please take time and solve the question. I will give you a break. Don't worry. Don't worry. I will give you a break. Don't worry. आगे बात समझ में ना? Yes, very good. सिटी स्कैन थोड़े ना है? Yes, very good. ये एम्स का क्वेश्चन था, ये एम्स का क्वेश्चन था, सिंपल है. सो बेसिकली विच ऑफ द फॉलोइंग इज नॉट अ कंपोनेंट ऑफ एमएससी? रेडियोलॉजिकल इन्वेस्टिगेशन बहुत बाद में करते हैं यार, अगर जरूरत पड़ेगी तो, अगर कोई इंजरी हुआ है कभी तो, अदरवाइज नो नीड ऑफ दैट. ठीक है, इजी टू अंडरस्टैंड. आंसर विल बी ए ओनली, राइट? ओके फाइन. अब ये पूछोगे सर आपने बोला मूड एंड अफेक्ट, है ना? कि मूड एंड अफेक्ट बोथ मींस इमोशन. ठीक है, समझ में आ गई बात. सर व्हाट इज द डिफरेंस बिटवीन मूड एंड अफेक्ट? प्लीज राइट डाउन. Mood and affect both means emotion only. Mood is a long standing and internal emotion, and internal emotion. Affect is a short term, and this is externally visible. एक बार जरा लिख लो. Mood and affect both have the same meaning. Emotion only. Both have same meaning, emotion only. But mood is a long term, affect is a short term. But बोलो सर क्या difference समझ में तो नहीं है, I did not understand क्या मतलब हुआ. Suppose if I have a patient, Dr. Nivitika, sir, can you please speak only in English? See, I'm using 99% of English. So some words which I'm using Hindi, you know, like I'm doing the translation also. Don't worry, okay? Don't worry about that. Fine, no? So Dr. Nivitika, Jack, right? So like suppose if I will be using any Hindi, I will be doing that kind of, you know, like English translation will be there. Don't worry about that. Okay. Chalo, fine. So what does it mean? See here, mood and affect both have same meaning, emotion. So how to differentiate? See, suppose if you have a patient, suppose if I have a patient in my OPD, what patient is saying, doctor, you know one thing, for last 1 month, I have been very, very sad. For last 1 month, I have been very, very sad. But now when I see you, I'm smiling. See, kya kara patient? What patient is saying here? For last 1 month, I was very, very sad. But now when I see you, I'm smiling. What does it mean? For last 1 month, it was mood, internal. But now, on the spot, he or she is smiling. She is smiling. So now this will be called as what? Affect. Affect. है ना? Internal emotion for last 1 month, which he was hiding. No one was able to understand what was happening. But affect, now I can see that my patient is smiling. Externally visible, no. Externally visible, no. That's it. That is called as what? Affect. Suppose if you have a patient of diabetes mellitus, you are doing two tests, HbA1c and a random blood sugar. Random blood sugar. Dr. Vidhi, I'm glad. ठीक है? Chalo, fine. See, yes. So suppose if I have a patient of diabetes mellitus, HbA1c. HbA1c will give you sugar level of last 90 days. Random blood sugar will give the sugar level on the spot. So now tell me, HbA1c is similar to mood or affect? Mood, long. On the spot, you batao, RBS. RBS similar to what? Affect. RBS is what? Affect. Very good. Very good. So what are the disturbances of emotions? What are the disturbances of emotion we should know here? See here. So overall, whenever we have a patient, we have to check the emotional status. We have to check the emotional status. So first of all, we have to check the quality of emotion, then fluctuation of emotion. See, first break, tea break, I will give you at 6:30. ठीक है? तो आराम से रहो 6:30 पे first break. I also need a cup of tea, right? But at 6:30, ठीक है? All right, चलो. So first of all, whenever I have to check the emotional status of a patient, first of all, I want to check quality of the emotion. Then fluctuation. So either there can be depression, there can be euphoria. First of all, class will be up to 9 p.m. Okay, fine. First of all, please write down a word, euthymic. Euthymic mood, please write down. Euthymic mood means normal mood. Normal mood is called as a euthymic mood. Normal mood is called as a euthymic mood. ठीक है? यही मूड अगर एलिवेट हो गया तो बोलते हैं यूफोरिया. Euphoria means what? So what is the meaning of euphoria? So euphoria means what? Excessive happiness without any reason. Euphoria मतलब बहुत खुश. Severe happiness. Euphoria means what? Excessive happiness without any reason. Euphoria. After abusing bhang and ganja, if a person is laughing, jumping, dancing, if you ask what happened, I don't know. That is euphoria. यही मूड अगर डिक्रीज हो जाए, डिप्रेशन. Depression. Depression. Very easy to understand. Right. Okay, fine. One more word, please write down. Dysphoric mood. Please write down. Dysphoric mood. Dysphoric mood. Please write down. Dysphoric mood. Irritated mood. Irritated mood. Irritated mood. With sadness. Irritated mood with sadness. Irritated mood with sadness. Yes, please write down. Euthymic matlab normal mood. Euthymic means normal mood. Mood elevation, euphoria. Mood is going down, depression. If there be irritation, that is called a dysphoric mood. Dysphoric mood. Yaad rahega? Dysphoric mood. Easy to understand? Dysphoric mood. Okay. Now, I want to see how mood is getting fluctuating. How mood is getting fluctuated. Suppose if there is a female, her age is only 23-year-old. She is only 23-year-old. So one time she is laughing, another time she is shouting, laughing, shouting, laughing, shouting. है ना? एक बार हंसती है, एक बार रोती है, एक बार हंसती है, एक बार रोती है. Laughing and crying, laughing and crying, laughing and shouting, laughing and shouting. And she is a female. तो आप तो बोलोगे क्या? Sir, it is normal because she is a female. It's fine. चलो जोक्स अपार्ट, बट सी देखो, If every time, if there be what fluctuation of emotion like this, no fluctuation of emotion, and women, fluctuation of emotion like this, okay, it is called as emotional labile. क्या बोलते हैं इसको? Emotional labile. है ना? It is called as what? Emotional labile. है ना? देखो चलो वो jokes apart, है ना? But some people can have, है ना, कि one time she is laughing, another time she is crying, laughing, crying, laughing, crying. So basically what I'm saying is that, see, fluctuation of emotion, it is called as emotional labile. Please write down. See, emotional labile means what? Unstable emotion, unstable emotion, unstable emotion. Please write down unstable emotion. Emotional labile means unstable emotion. See, in which condition you will see emotional labile? Please write down. Yes, Dr. Swarup. Okay, fine. BPD case. Please write down borderline personality disorder, bipolar disorder, schizophrenia. After the pregnancy and all, yes, this can happen, but especially in which psychiatric condition? Okay, borderline personality disorder. Dr. Rahul, just now you have joined. We are into first chapter only. You can see the topic. You can check. Right, first chapter only. Okay, 4 or 5 pages we have completed. So in which condition we can see emotional labile? Borderline personality, bipolar, and schizophrenia. See here, and 100% opposite is what? Affective flattening. Page number 4. Okay, Dr. Rahul Sharma. Affective flattening means flattening of emotion. If ECG is like this, person is alive. If ECG is a flat, that person is flat. मतलब गया वो. So if there is no emotion at all, suppose if there is no change in expression, no fluctuation at all, that is called as affective flattening. Suppose if any of your batchmates, suppose if like FMG result is out. Suppose if FMG result is out, okay, and your friend has a scored up to 243. Suppose if your friend has a scored, he has a scored up to 243. When you are asking, hey, result is, you have a score 243, he's saying what? Acha. After that you slapped him, he's saying, acha. No change in expression, no change in emotion. Basically no emotions at all. That is called as affective flattening. That is called affective flattening. Please write down. It is seen in schizophrenia. See, it is seen in schizophrenia. See, affective flattening can be seen in schizophrenia. Schizophrenia. Okay, fine. Appropriateness as per social situation. As per social situation, right now? Yes, great. And I see here, appropriate. Suppose if a person is laughing in a graveyard, Shamshan Ghat mein, right now? Dr. Abel say yes. See, suppose in a graveyard, if a person is laughing, in a graveyard, if a person say, wow, what a gathering here, yeah, right now, sir. See, everyone is looking so handsome, so good, wow, wow, wow. If a person is laughing in a graveyard, inappropriate. Simple. So as per a social situation, so please write down only schizophrenia. देखो schizophrenia patient कौन होते हैं? Who is called as the schizophrenia patient? Especially when I talk about Indian, Indian states, anyone see here, any person in a village or in a city who is referred as a pagal, mad person. So many people will understand he is mad. He is actually pagal. ये जो real word जो pagal होता है ना, pagal word, mad word. So especially for schizophrenia patient, like we are using in India. ठीक है? Okay. Now next word is what? See here, next word is very, very important word. That is called a word congruency. See here, as per the thought and speech. See, whatever is there in your mind, it should be there on your tongue. Actually, your thought and speech should be matching, right? Your thought and speech should be matching. Suppose if a depressed patient is saying, see, suppose if a depressed patient is saying what? And I see like everyone is going to die. It suits him. So thought and speech both are matching. Yeah, but if a different, suppose if a depressed patient is saying what? I am the richest man on the earth. Do you think it suits him? Eh? What? बोलने की हिम्मत नहीं तेरे richest man बनने. Eh? So what does it mean? It is incongruence, right? It is incongruence. You know, this is what incongruence. Remember here, see here, when thought and speech are not matching, it is called incongruence. लिख लो यहाँ पे. It is called incongruency. Incongruency. Affective flattening means what? Flattening of emotion. No fluctuation, Dr. Kishore. Okay, no emotions at all. Incongruency means what? Suppose if a 19-year-old boy is there who lost his mother in a recent road traffic accident, right? How he is explaining that death story of his mom to one of his friends. See here, how he is explaining that death story. Ideally, he should be very, very sad, you know. Ideally, he should be very, very sad, but how is explaining? Hey, you know how my mother died, huh? 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 See, the way he is explaining, see, actually it is wrong, right? It is wrong. Thought and speech are not matching. It is called as incongruency. So can you tell me 4 disturbances of emotion? Okay, first is the quality of emotion, fluctuation of emotion, appropriateness of emotion, and what? Congruency of emotion. So what are the examples of the quality of emotion? Can you answer me? Bolo answer karo. What are the examples of the quality of emotion? Euphoria and depression. Okay, fine. Fluctuation of emotion का बताओ. Labile and affective flattening. Labile and affective flattening. See, देखो, whenever I talk about euphoria and depression, see, these two, do you think they can be seen in bipolar? और mania हो सकता है, mania में दिख सकता है, right? So do you think I should be talking about some mood stabilizer drugs also? Yes. So can you write down some mood stabilizer drugs in chat box? All of you, please write down. Mood stabilizers हम लिखो. Mood stabilizer से drug के नाम लिखो, जितना याद है याद बताओ. How many you are able to recall? Please write down. Benzodiazepine is not. No. SSRI is not. Chai, yes. 100% yes. लिखो. Please write down. Alprazolam no beta. वो तो benzodiazepine है ना. Okay, fine. Please write down. Please write down. Write down. Write down. Lithium. Please write down lithium. Lithium. Second, write down valproate. Write down valproate. After that, please write down carbamazepine. Carbamazepine. After that, please write down oxcarbazepine. All of you write down, लिखो दवा के नाम लिखो. Fifth लिखो lamotrigine. Lamotrigine. See, देखो, actually there are so many mood stabilizers, but these 5 are most important. These 5 every time you have to keep in mind. Lithium, valproate, carbamazepine, oxcarbazepine, and lamotrigine. याद रहेगा, and lamotrigine. Lithium, valproate, carbamazepine, oxcarbazepine. Yes, doctor. Yes. है ना? Oxcarbazepine and lamotrigine. ठीक है ना? 5 SSRI which I have taught you: fluoxetine, sertraline, escitalopram, dapaxetine, paroxetine. I have used some SNRI examples: venlafaxine, desvenlafaxine, duloxetine. Okay, सबको इतना याद रहेगा. I hope all these points are clear to everyone. ठीक है, सबको याद है. See, suppose if you have understood this, must solve this question now. Solve this question, please. Okay, doctor, I'm glad. Yes. Depressed mood क्या बताओ? Okay, quality of emotion, right? The quality of emotion. See, at the same time, if I ask you what about the emotional labile, see, emotional labile is an example of what? ABCD. Labile, fluctuation of emotion. Fluctuation of emotion. See this question now. Solve this question, please. All of you, solve this question. Congruency. See, this was asked in AIMS question. Very good, very good, very good. Okay. Okay. See some other examples of emotional problem. Anhedonia. Over what is the meaning of anhedonia? Inability to enjoy or inability to experience the pleasure. See, inability to experience the pleasure. Inability to enjoy. Here patient will say, what, sir, earlier I used to enjoy, now I do not. पहले मजा आता था, अब नहीं आता है. Earlier I used to enjoy, now I do not. So like after marriage you are saying, Dr. Arafat, acha. This is called what? Anhedonia. This is called what? Anhedonia. Inability to experience the pleasure in old activities. Alexithymia, relationship issues might be. Okay, chalo, theek. Alexithymia, please write down. Inability to express. Inability to express or understand the emotion or understand the emotion due to lack of words. Due to lack of words, please write down. Anhedonia means what? Anhedonia means inability to experience the pleasure. Alexithymia means what? Inability to express or understand the emotion of other people because of lack of words. Anhedonia, alexithymia. Anhedonia, alexithymia. Very, very, देखो, see, one-liner question, minimum 1 or 2 one-liner question you can expect in psychiatry. So that's why we are supposed to memorize the word. That's why I'm explaining everything right in detail. One-liner question आएगा, miss नहीं करना दोस्त कभी भी, ठीक है? One-liner question. Anhedonia, alexithymia. Okay. Dr. Ashwin, no, it is not. It is lack of mood, which I will teach you in mood disorder. Don't worry. It is not anhedonia. Okay. चलो फाइन, ठीक है, चलो फाइन. सो ये बताओ अब इसमें से एक चीज, विच पार्ट ऑफ ब्रेन जनरेट्स द इमोशन. बताओ, विच पार्ट ऑफ ब्रेन जनरेट्स द इमोशन. बोलो, आंसर करो ऑल ऑफ यू. आई थिंक वो स्लाइड मिस हो गया यहां पे, बट आंसर करो. Which part of brain generates the emotion? Okay, please write down. Limbic system generates the emotion. Please write down. Limbic system generates the emotion. Limbic system generates the emotion. Limbic system generates. You बताओ, what are the components of limbic system? What are the components of limbic system? Match. M-A-T-C-H. Which anatomical structures make limbic system together? Mammillary body, amygdala, mammillary body, amygdala, T for thalamus, C for cingulate gyrus. Cingulate gyrus. H for hippocampus. These 5 neuroanatomical structures all together they make a limbic system. Mammillary body, amygdala, mammillary body, amygdala, amygdala. T for thalamus, C for cingulate gyrus. Cingulate gyrus. Cingulate. Cingulate gyrus. Cingulate gyrus. Gyrus. H for hippocampus. Remember, limbic system is like factory house. It generates the emotion, but emotions are regulated by, please write down, emotions are regulated by frontal lobe. See, emotions are regulated by frontal lobe. You can say limbic system is like factory house and frontal lobe is like a remote control. Frontal lobe is like a remote control. Easy to understand. Same thing as, suppose if you are in the prayer room. Okay, suppose if you are in the prayer room and you are able to recall old jokes. Old jokes you can get because of limbic system, but you are not supposed to laugh because of frontal lobe. हंसना नहीं है because of frontal lobe. Remember, limbic system generates the emotion, frontal lobe regulates the emotion. Very easy to understand. I hope all these points are clear to everyone. Now you can take a short break. After that, we are going to start with the disorders of all perception. All perception. Okay. Alexithymia means what? When a person is not able to express the emotion. Okay, when a person is not able to express, the emotions are there. Okay, but he is not able to express, right? Okay, now short break you can take for 15 minutes. Okay, short break for 15 minutes only. Okay, short break, have tea, coffee, come back. Okay, tea, coffee. Okay, match Dr. Haja. Match mammillary body, amygdala, thalamus, cingulate gyrus, hippocampus. Okay, Dr. Bharat, for tomorrow I will explain you. Timing बता देंगे आपको, ठीक है? Okay. Okay, fine. See you after 15 minutes. Have tea, coffee, come back. Okay? Chalo, thank you so much. Dr. Ashwin, like this is 100% injurious. 100% injurious. Dr. Poonam, first of all, there is a fresh bleeding, so the dye will get mixed. And second, like before you inject any contrast, you have to perform one blood test that is called a renal function test. A report will come after 1 hour, so you cannot wait for that much time now. And because if creatinine level will be so more than 1.5, there will be the contraindication. There can be a renal failure. Okay, Dr. Poonam? Chalo, fine. Yes, have dopamine and serotonin come back, and acetylcholine also come back. Okay, chalo, see you after 15 minutes. चलो fine, we can start now. Everyone, please get back. Okay, चलो. Who coined the term psychiatry? बोलो. Who coined the term psychiatry? Who coined the term psychiatry? John Christian Ryle. John Christian Ryle. Okay. Okay, fine. Now you tell me 5 SSRI name. Please write down in chat box. All of you, please write down 5 SSRI name. बोलो. 5 SSRI. Fluoxetine. और लिखो. All of you write down. Write down. जितनी बार लिखोगे उतना याद रहेगा. Okay, Dr. Poonam, you are asking about the meaning of neurological deficit, right? Dr. Poonam, you are writing the meaning of, you are asking the meaning of neurological deficit. Any problem because of the nervous system, like loss of speech, loss of memory, loss of sensation, loss of balance, right now. So these are the neurological deficit. Okay, Dr. Poonam? Chalo, fine. Okay, fluoxetine, sertraline, escitalopram, dapaoxetine, and paroxetine. Okay, fine. Dr. Meghna, what the meaning of the pre-morbid personality means? What kind of a person he or she was before this kind of, before the disease, right? What kind of person he was before? Okay. ठीक है, चलो फन ये बताओ कि what are the examples of SNRI? Venlafaxine, desvenlafaxine, duloxetine. What are the indications of starting a patient on SNRI? Can you answer me? What are the indications of starting a patient on SNRI? Lack of energy, lack of motivation, lack of drive, and a lack of drive. Okay. Okay, very good. Yeah, I think most of you are back, so we can start with the new topic now. Chalo, okay, very good. See here, now see here. So overall, I have taught you, see, suppose if a person is not able to enjoy, right? That is called a what? Anhedonia. Suppose if a person is not able to express the emotion, that is called a what? Alexithymia. Can you answer me? Which part of brain generates the emotion? Dr. Salil, so tomorrow what? 10:30 or 11 tomorrow. Okay, Dr. Salil. Okay. Which part of brain generates the emotion? Limbic system. So can you tell me 5 components of limbic system? Match का full form बोलो. Match full form. Mammillary body. Amygdala. Thalamus. Cingulate gyrus. Hippocampus. See here, so when I have mentioned here match, see when I have written here match, right now, when I have written here match, so what I'm saying is that all these 5 neurological components, these are making limbic system together. So do you think if there will be any injury, if there will be any damage to these 5 neuro or any of these 5 neuroanatomical structures, do you think there can be, so do you think there can be any emotional problem? Any emotional problem? Yes. So yes, there can be some emotional problem. Yes, there can be what? Yes, there can be what? Emotional problem. Yes, there can be emotional problem. Easy to understand? Right? Okay, fine. So see, yeah, what kind of question they have framed in last time NEET PG? After accident, a person is not able to express his emotion. After the accident, a person is not able to express his emotion. This can be due to injury in which of the following anatomical structures? Okay, ठीक है. तो ऑप्शन में क्या कहता है? पिट्यूटरी ग्लैंड, कॉर्पस कैलोसम, हिप्पोकैम्पस, ऑल ऑफ दिस. क्या होगा आंसर? सिंपल, हिप्पोकैम्पस, बस हो गया आंसर। ठीक है ना, हिप्पोकैम्पस। ऐसे क्वेश्चन बनते हैं और क्या, ऐसा ही सिंपल है। ओके फाइन, नाउ टेल मी, इमोशनल लबाइल इज एन एग्जांपल ऑफ फ्लक्चुएशन ऑफ इमोशन एंड क्वालिटी ऑफ इमोशन। Fluctuation of emotion as per social situation. Appropriateness. Yes, it's very simple now. Yes, very, I'm glad. Yes, है ना। ओके फाइन, ठीक है। अच्छा, वो क्या था, when speech and thought are not matching, then it will be called as what? Incongruency. Incongruency is opposite. Incongruency is opposite. Okay, chalo fine. Now see here, we have learned, see, like MSc mental status examination for organic mental disorder, what it was, MMSE, mini mental status examination, right? Okay fine, ye batao, visual hallucination is more common in organic or non-organic? Visual hallucination, organic, right? Organic, right? Organic, very easy to understand. Okay fine, ye batao, overall, if I ask you one question, overall, what is the most common type of hallucination overall? ओवरऑल क्या है, ऑडिटरी हेलुसिनेशन, ऑडिटरी हेलुसिनेशन। ठीक है, चलो फाइन, नाउ लेट्स लर्न ऑल द डिसऑर्डर्स ऑफ परसेप्शन। वेरी गुड, वेरी गुड। Dr. Ashwin, sir, I'm a little worried. All these are very fragile and easy to forget, all these things. No problem. We have to keep on revising. This is the same logic with all the subjects. You have to learn all these are, but yes, like see here, like every day on daily basis, we are going to revise again and again. So there is simple logic to keep everything in mind, again and again revision. That's it. Okay. Okay. That's it. Okay, children, now all disorders of perception. So what is the meaning of illusion? Please write down. False perception of a real object. False perception of a real object. Let's write down. Definition of illusion. False perception of a real object means something is there, but see, something is there, but the perception is wrong. Suppose if I'm showing my pen to my patient, after that my patient is getting scared. Oh my God, like patient is getting scared. Oh my God, revolver. This is what? False perception of a real object. Something is there, but perception is wrong. That is called an illusion. Hallucination, false perception in the absence of any object. Means nothing is there, but you can see something. That is called a hallucination. Autoscopy means what? Seeing own imagination. Seeing own imagination, अपने आप को देखना, seeing own imagination, seeing own imagination. So this can be there when there is what? So much of a stress, so much of a stress. Seeing oneself, that is called a what? Autoscopy. Okay, autoscopy. Now depersonalization and derealization, what does it mean? Depersonalization or a derealization? So see here, इसमें क्या होता है यहाँ पे समझो, depersonalization and derealization means what? Like suppose if a young man, suppose if a young boy who was in a relationship with a beautiful girl, she was very, very beautiful, she was very, very beautiful. Okay, in the beginning he was very happy. In the beginning he was very happy, but after 1 month he got to know that she was suffering from borderline personality disorder. She was suffering from BPD, frequent mood swings without any reason, frequent fights without any reason, every day fight. After 1 month, breakup, horrible breakup. Now this young man is sitting in my OPD. Now he's saying, what, sir, you know one thing, I'm in so much stress. You know, as if inside my body, everything is changed. I'm not the same person which I used to be before. I was a man once upon a time. इसको क्या बोलेंगे? Depersonalization means I'm not feeling the same person which I used to be. Right? Depersonalization. Depersonalization. As if inside my body everything is changed. And doctor, you know one thing, outside also, these people, my friends, my family, these are also changed now. Outside also everyone is changed. That is called a derealization. Derealization. Please write down where, in which condition you can see. Under so much stress. Under so much of a stress. Under so much of a stress. Dr. Antharu, like when a person is feeling that as if I am changed as a person. I'm not the same person which I used to be. Right? That is called a depersonalization. And as if outside also everyone is not the same for me. That is called a derealization. Please write down. These can be seen when there will be severe stress. Okay, when there can be, even in a case of panic disorder. Even in a case of panic disorder. Even in a case of panic disorder. Even in a case of drug abuse, please write down, even in a case of drug abuse, like LSD and cannabis. Please write down. Please write down. So even in the drug abuse, also LSD abuse or the cannabis abuse, yes, you can see what? Depersonalization and derealization. Depersonalization and derealization. Okay, fine. Yes, I will repeat it again. Don't worry. So what I'm teaching you now, I'm teaching you the disorders of. I'm teaching you the disorder of the perception. Okay, I'm teaching you disorder of perception. How do we perceive anything? Illusion means what? False perception of a real object. Something is there, but how a person is going to see that, that is different. I have given you the example. Suppose if I'm showing my pen to my patient, after that my patient is getting scared. Oh my God, revolver, 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 revolver. So this is what? Illusion. Illusion. Something is there. कुछ है वहां पे, लेकिन दिखाई गलत दे रहा है. That is called as illusion. Right? That is called an illusion. Right? Okay, fine. That is seeing a ghost. That is hallucination. Right? Okay, fine. So false perception of a real object is called illusion. Hallucination, nothing is there, but you can see something. Basically, false perception in the absence of any stimulus. False perception in the absence of any stimulus is called as hallucination. Autoscopy means what? Autoscopy, when a person can see his own image. Own image. Pehle ye batao, this is what? This is illusion or hallucination. Can you answer me? Dr. Poonam, yes. After seeing a rope, if a person is feeling that there is a snake, that is illusion. Right? Illusion. Ye kya batao yahan pe? Autoscopy. Right? No, autoscopy means what? Seeing own imagination. Seeing own imagination. Own imagination. Own imagination. Right now? Yes. Yes, Dr. Ashwin. Okay, this one is nothing but illusion. This is illusion. See, yeah, after seeing a rope, if a person is getting scared, oh my God, a snake, a snake, a snake, that is called a what? Illusion, illusion, illusion. Okay, this is illusion. ठीक है? Okay, depersonalization, derealization मतलब क्या होता है? Because of severe stress, if a person is saying what? As if I have changed from the inside, as if I am not the same person which I used to be. That is called as depersonalization. As if outside also, all other people are also changed for me. That is called as derealization. That is called as derealization. See, every time if a person is saying what? As if, right? Okay, fine. Okay, so that's why it is also called as if a phenomena. Please write down. This is also called as if a phenomena. Dr. Poonam, this can be different also, no problem. Dr. Hari Krishna, so that will be hallucination, right? Hallucination, that will be normal hallucination, okay? I hope all these points are clear to everyone. Dekho, see, these are one-liner questions. See here, see, suppose if I ask you one question that if a person is not able to enjoy what it is called as, please write down in chat box. Anhedonia, right? Anhedonia. Okay, what if a person is not able to express his emotion? Alexithymia, right? Alexithymia. ये बताओ, ये बताओ, awareness about disease. बोलो. Awareness about disease is called a what? Insight. Insight, not OCD, Dr. Percy Samuel. Insight, no, insight. Word is insight. Now, suppose if insight is present, right now, Dr. Shornika, that is just the feeling of the patient. Suppose if it insight is present, neurosis. Okay, judgment power will be normal in psychosis or neurosis. Neurosis. Okay, reality testing will be normal in neurosis. Okay, personality is disturbed in psychosis or neurosis? Psychosis, है ना? Psychosis. Okay, बताओ. See, schizophrenia is an example of psychosis or neurosis? Psychosis. What about, see, बताओ, OCD? OCD is an example of psychosis or neurosis? Neurosis. अच्छा, वो क्या था? Egosyntonic means what? Egosyntonic means agreeable to self, है ना? Agreeable to self. Okay, dystonic का मतलब क्या था बताना जरा? Dystonic, disagreeable to self is called as disagreeable, right? Disagreeable to self. When a person is not happy in his life, that is called a what? Disagreeable, right? Disagreeable. Very good, very good. But नहीं समझ में आ रहा. All personality disorders are egosyntonic or dystonic? Syntonic. Syntonic का मतलब क्या होता है? When a person says, I am fine, I am okay, I am normal, it means syntonic. Oh my God, what is? Oh my God, I am not okay. So that is dystonic. That is dystonic. ठीक है, इतनी बात समझ में आ गई? Easy to understand. चलो, now आगे बढ़ेंगे हम लोग अब. ठीक है, fine. Now देखो, see, now we are going to learn about hallucinations. Hallucination, very, 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 very important. Dr. Poonam, like anything you can see. Okay, that is not the rule. Okay. Maybe somewhere in the movie, somewhere. Okay. Now hallucination, we are going to learn hallucinations. Okay, see here. Like, have you seen this movie? Lage raho munna bhai. See, in this movie, Sanjay Dutt, every time he used to speak with Gandhi ji, he used to see Gandhi ji. So visual hallucination, auditory hallucination. At last, है ना, वो at last वो बोलता भाई बोले तो दिमाग में chemical का लोचा. That chemical was nothing but neurotransmitter, right? No, neurotransmitter, right? A neurotransmitter. Okay, fine. So now let's learn some one-liner point here. See here. See this question now. See this question and try to answer. Shankar Dada, yes. Dr. Imtiaz, Dr. Haja, Dr. Shinit, Dr. Meghna, very good. Dr. Minu Mariam, okay, Dr. Shiva, okay. I can see here that 70% of you have marked A. And like some of you have marked B also. B also. Okay? Let's learn this part. Okay, so most of you are wrong here. See, there are 4 criteria to diagnose a real hallucination. First of all, इसमें क्या है कि it should occur in the absence of any stimulus. ये तो definition हो गया. This is as vivid as real. Means 100% same to same. 100% same to same. See, yes, so Gandhi ji को है ना, see देखो, Sanjay Dutt has seen Gandhi ji every time only in a white cloth. He never saw Gandhi ji in jeans and t-shirt. So this is as vivid as real, means exactly same to same. So that's why insight will be absent. Suppose if a person is having any visual hallucination, no? Suppose if that person can say, I can see that person. So it means he can see that person. After, suppose if he say, hey, no, like no one is there. So he will say that, hey, you are psycho. I can see he's standing here only, right? So insight will be absent. I know. So remember here, see, this is as vivid as real, 100% same to same. Experience in outer objective space. What does it mean? यहाँ पे क्या patient will say what? Yes, I can hear some voices, and these voices are coming from out of the wall. आवाज आ रही है, बाहर से आ रही है, बाहर से आवाज आ रही है. I can hear some voices, and these voices are coming from outside. Outside is the real hallucination. Suppose the patient is sitting here, patient will say, yes, some voices are coming, but these voices are coming from outside. Outside, that is a real hallucination. Right? That is outer objective space. Suppose the person is saying, I can hear some voices, voices are originating within my own mind, inner subjective, that will be pseudo hallucination. It will always be involuntary. Means whenever patient wants, he cannot hallucinate. It is always involuntary. Always keep in mind. It is always involuntary. Fine. No? Out of these four, against will be pseudo hallucination, false hallucination. Pseudo hallucination, last to last time FMG question. So now can you answer this question? Bolo. Answer क्या है? Pseudo hallucination. This is a case of what? Pseudo hallucination. This is a case of pseudo hallucination. I hope all these points are clear to all of you. Okay? Pseudo hallucination. Very easy to understand. So what are the four criteria? Can you answer me? Can you write down in chat box? Four criteria to solve the real hallucination. Absence of an stimulus, as vivid as real, outer objective space, involuntary, right? Very good, very good. So these are the four rules for real hallucination. Fine. But there are some special types of hallucination which do not obey all the criteria. Please write down. देखो पहले hypnopompic and hypnagogic देखेंगे. Hypnagogic में focus on go. See here, hallucination before going to sleep. Please write down. Hallucination before going to sleep is called as hypnagogic. Hypnagogic. Hallucination before getting up. Hallucination before getting up is called as hypnopompic hallucination. Please write down. These two are seen in sleeping disorder. Which sleeping disorder? Please write down. Narcolepsy. Narcolepsy. So what is the drug of choice for narcolepsy? Can you answer me? What is the drug of choice for narcolepsy? Dr. Vishal Malokar, very good. क्या है आंसर बताओ? What is the drug of choice for narcolepsy? Modafinil. Dr. Minesh Rohit, very good. Very good, Dr. Buthula Sai. Yes, modafinil, है ना? Modafinil. Modafinil. Very good, very good, है ना? See, the drug of choice for narcolepsy is what? Modafinil. So ये दोनों सबको clear हो गया. Hypnopompic and hypnagogic. Yes, hallucination before going to sleep is called as hypnagogic. Before getting up is called as what? Hypnopompic. Hypnopompic, right? Okay, fine. Now synesthesia. This time question. Synesthesia इस बार question आया था. Synesthesia, please write down. See, देखो synesthesia, please write down. See, stimulus in one modality. Please write down. See here, I will be speaking. You write down full sentence. Stimulus in one modality will produce hallucination in another modality. Stimulus in one modality, hallucination in another modality. Meaning क्या है? अभी सीखेंगे meaning. See, what I'm saying is that stimulus in one modality, hallucination in another modality. What does it mean? Here patient is saying, what ki sir, whenever I'm looking at the tube light, okay, whenever I'm looking at the tube light, I start hearing the voices of God. I start hearing the voices of, see, stimulus in visual, hallucination in auditory. It is called as synesthesia. It is called as what? Synesthesia. समझ में आएगी बात? Synesthesia. See, stimulus in one modality will produce hallucination in another modality. Patient क्या कह रहा है? कि डॉक्टर साहब, whenever I'm looking at a tube light, I start hearing the voices of God. So I have to switch it off. I have to switch it off, right? I have to switch off the light, right? So this is nothing but synesthesia. Please write down. This can be seen in drug abuse like LSD and cannabis. and cannabis. Here a patient can say what? Here a patient can say what? I can hear a light. I can watch music. Dr. Shiva Sharmi is asking, sir, but hallucination comes with absence of any stimulus. No, yes. That's why I'm saying these are special types. Okay, so these are exceptionals. These are a special type, Dr. Shiva Sharmi. Okay. डॉक्टर हारून सपना नहीं होता, हेलुसिनेशन होता है वो, ठीक है ना, रियल में हेलुसिनेशन होगा. सी हियर, like here patient can say what? I can hear light, I can watch music after abusing bhang. ये please write down this example. Example लिख लो जरा. 2 times the same example they have asked कि after abusing bhang a person is saying what? He can hear light, he can watch music. So it is called as what? Synesthesia. It is called as what? Synesthesia, which is also called as reflex hallucination, which is also called as reflex hallucination. Reflex hallucination. This is also called as reflex hallucination. Okay, reflex hallucination. Easy to understand? Reflex hallucination. So this time, what was the question they have asked? Ki a patient was abusing multiple drugs. A patient was abusing multiple drugs. A person was abusing multiple drugs. Now, after that, he's complaining what? Whenever he is hearing radio FM, after that, he can see a red halo in front of his eyes. So, which drug he was abusing? Right now? Easy to understand? So, that is what? Synesthesia. कौन सा था वो? LSD was the option. LSD, right? Dr. Ashwin, all these are same. Bhang is cannabis, marijuana, sub same hai. I will teach you. Don't worry, sub same hai. Okay, same. Easy to understand? So remember here, this time from synesthesia, they have asked the question. Answer was LSD, LSD, LSD. Functional hallucination means what? See, stimulus in one modality, hallucination in same modality. Please write down. Functional hallucination, please write down. Stimulus in one modality, hallucination in same modality. Dr. Ahmad is asking, sir, is it wrong to try LSD once? See here. Every time it is wrong. Wrong means wrong, but drug abuse is wrong. एक बार से तो आदत लगती है और क्या? If please write, functional hallucination means what? Stimulus in one modality, hallucination in same modality. Same modality. So remember, synesthesia is seen in LSD also, cannabis also, right now? Okay. Easy to understand? Now, functional hallucination means what? So here, functional hallucination patient will say, what? Doctor, you know what is happening with me? Whenever I hear that tick, tick, tick sound of a wall clock, I start hearing the voices of God. What does it mean? See here, stimulus in auditory, hallucination in auditory. Stimulus in auditory, hallucination in auditory. That is called as what? Functional hallucination. Functional hallucination. Okay, extra combine means what? Extra combine. Extra combine means what? Seeing beyond the sensory field. Seeing beyond the sensory field. Seeing beyond the sensory field. Seeing beyond the sensory field is called as what? Extra combine. So what does it mean? Like suppose if a person is standing here, what he can say, you know, I can see that out of this wall, one person is standing and he is having a revolver. Then I will go out, he will kill me. So he can see beyond the wall also. It's impossible hai na yaar, दीवार के बाहर को कैसे देख लेगा? Or you can remember like this. Suppose if a person is standing in a camp, he can see beyond the camp. It is called as extra combine. It is called as extra combine. I have taught you 5 special types of hallucination. Can you answer me? Yes, doctor, it was LSD. Answer bolo se batao, okay, see here. So overall, I have taught you 5 special types of hallucination. Please write down. Bolo likho sab log without seeing the notes likho. Hypnopompic, hypnagogic, synesthesia, functional hallucination, and extra combined. Okay, synesthesia is also called as रिफ्लेक्स हेलुसिनेशन. ये बताओ, ये जो फंक्शनल हेलुसिनेशन है, फंक्शनल हेलुसिनेशन एंड फंक्शनल पेशेंट बोथ आर सेम और डिफरेंट? फंक्शनल हेलुसिनेशन और फंक्शनल पेशेंट, देखो एग्जामिनर विल गिव यू इन द ऑप्शन, एग्जामिनर विल गिव यू बोथ. फंक्शनल पेशेंट मींस फेक पेशेंट. See, देखो functional patient means fake, who was only acting. Overall, whenever you will start practicing in hospital, no, almost on daily basis, 1 or 2 fake patients you will get in hospital. On day 1 of my emergency department duty, day 1 in hospital, day 1 in emergency, what happened with me? हाँ, तो different हुआ ना, functional patient and functional hallucination, both are different. See, देखो, there was a case, what happened? No, so there was a case like on my day one of emergency department when I have joined the hospital. That was in New Delhi. So like one emergency case, one newly married female who was fully unconscious. She was brought to emergency department. She got admitted in the emergency department right now. And she was brought by 7 or 8 people. All were in-laws only, husband and in-laws. Fine. So when I found that there was one unconscious patient, so I rushed there, I ran there. I thought maybe heart attack. I see, when you will be a junior doctor, no, all cases will be appearing like, all cases will be appearing like heart attack only. Okay? So when I rushed there, now what happened with me? I checked blood pressure, pulse rate, everything was normal. Even the breathing was also normal. I asked my senior, sir, everything looks normal, but she is unconscious. And everything is normal, but she is unconscious. My senior told me, okay, see here, ask all the family members to go out. Ask all the family members to go out. I will show you a miracle. Okay, so after that, all family members went outside. So what my senior did, no, आपको पता स्पिरिट पता ना, स्पिरिट जो स्पिरिट होता है ना, वो अल्कोहल वाला स्पिरिट, वो स्वैब जिसे सफाई का क्लीन करते हो, सैनिटाइजर स्पिरिट. So like if you smell the spirit, no, like it will be having very much like a pungent smell. So much irritation will be there, no, pungent. What he did, he soaked a swab, cotton swab में मैंने spirit लगाया. अब वो lady का, he administered only 1 drop of spirit in her nose. After that, she got up like this. After she got up like, oh my God, this was miracle, right? This was miracle. So I asked my senior, sir, what was that? Come, I'll show you, come. After that, we sat in that OPD. He asked me, you have to invite only husband. At least husband will understand something. So what my senior wrote on the paper, very serious illness. What is the treatment? Only Bicosuls, OD for 10 days. Bicosuls ka multivitamin. After that, he wrote in the big letter, total body rest for 1 month at own mother's house. At own mother's house. I asked my senior, sir, what is this? What is this? After that, he told me, Dr. Nadeem, this is called as Sasural syndrome, in-laws syndrome. समझ में आया? फंक्शनल पेशेंट है. सही है. Next day in early morning by 11:30, what happened? By 11:30, A young boy, 17-year-old young boy, he was in school uniform. He was in school uniform. After that, he entered the emergency department. So I was sitting there with me, like there was CMO, Chief Medical Officer. And suddenly that young boy, he entered the emergency. So. Suddenly I got, oh my God, heart attack case. After, so. After that, my senior asked me, Dr. Nadeem, sit down. Sit down. I said, sir, heart attack, sir, heart attack. Like, sit down. I'll see the patient. I said, chalo, theek hai. After that, my senior asked me, अच्छा, तो सीने में दर्द है. He asked me, you have pain in chest. Oh, yes, sir. Severe pain you have, huh? Unbearable. Okay, fine. I will give you treatment. I was thinking, what kind of doctor he is? He said, you want complete treatment? Okay. Chalo, theek hai. I will give you treatment. First of all, you write down phone number of your father on this paper. After that boy, sir. After that, he left emergency department. I was waiting for that boy for half an hour that he will come back again. Okay, he did not come back. I asked my senior, sir, that young boy, 17-year-old, he did not come back here again, sir. That was the heart attack case, no? So my senior asked me, Dr. Nadeem, you are so innocent. See, 11:30 time, young boy, 17-year-old, school uniform, and 11:30, this is the canteen time. He might have proposed to someone, got rejected. It is called as heartbroken syndrome. Easy to understand. Sorry, all these cases are what? Functional hallucination. Dr. Abel Sebi, that was actually a newly married female. No, she was acting because of in-laws, right? Okay, no? So I hope now it is clear, right? And that is called a what? Dr. Ashwin, that will be alogia only, no? Right. So that is called as what? Okay, fine. So now you understand here. So overall, functional patient means what? 100% fake patient. 100% fake patient, right? 100% fake. Okay. Dr. Ripu Damania. I'm glad. चलो नहीं डॉक्टर शादन अगर टोकोट्सबू होगा ना देखो टोकोट्सबू अगर होगा ना तो देखो स्वेटिंग होगा ब्रीदिंग प्रॉब्लम होगा he was completely normal okay चलो fine so who coined the term psychiatry can you answer me who coined the term psychiatry John Christian Ryle okay chalo fine very good now see here some one-liner question see always keep in mind overall most common hallucination is auditory overall but organic mein visual but see always keep in mind if there will be any pathology in the temporal lobe no see here if there be so temporal lobe epilepsy temporal lobe pathology patient can have olfactory hallucination smelling hallucination and gustatory bole to taste hallucination so whenever there will be pathology in the temporal lobe whenever there will be temporal lobe pathology yes there can be olfactory and gustatory hallucination if there is a cocaine abuser what kind of hallucination will be there tactile hallucination what is the meaning of tactile hallucination here patient will be having this kind of feeling that under his skin some insects are there some bugs are there so he will keep on scratching the skin okay that is called as tactile hallucination so please write down ye batao so what are the other names of tactile hallucination overall what are the other names of tactile hallucination malingering is different so malingering is 100% lying because of medical legal aspect okay doctor malingering is different functional means what only acting to get rid of any problem behaving like a patient malingering jhoot bolna Okay, fine. Some other names of the tactile hallucination, can you answer me? Some other names? No, so not in 1 day, 2 days it will be coming. It will be coming after many, many months, many, many years. Okay. Okay, please write down. It is also called as formication. Formication. It is also called as cocaine bugs. It is also called as cocaine bugs. Cocaine bugs. Okay. Tactile hallucination, formication, cocaine bugs, and this is also called as Magnan's phenomena. Please write down. See, it is also called as Magnan's phenomena. See here, I'm telling you, please highlight the word tactile hallucination. Highlight the word tactile hallucination. Repeatedly asked question in FMG exam. Highlight the word. Magnan's phenomena, last time INI-CT question. Magnan's phenomena is associated with which of the following substance abuses? First answer was what? Cocaine. But do you think this your tactile hallucination, this can be seen only in cocaine? No, please write down. This can be seen in alcohol withdrawal also. This can be seen in alcohol withdrawal also. Alcohol withdrawal. Please write down. Tactile hallucination is seen in cocaine and then alcohol. Cocaine and then alcohol. Okay, I hope all these points are clear to everyone. Now we are going to learn all disturbances of thought. Overall, we have learned about disturbances of emotions. After that, we have learned about disturbances of the perception. I have taught you 4 disturbances of perception. Please write down in chat box. All of you, please write down in chat box. All of you, please write down in chat box. 4 disturbances. Illusion, hallucination, autoscopy, depersonalization, derealization, right? Derealization, depersonalization and derealization. ठीक है? Okay. ठीक है, चलो fine. Okay, so now we are going to learn about disturbances of all disturbances of thought. See, देखो यहाँ पे disturbances of thought very very important. देखो first chapter से you can expect 1 or 2 questions from first chapter only. So first chapter में I will be taking a lot of time. I will be taking so much time in like first chapter. After that schizophrenia and then depression and then substance abuse. बाकी ये 4 or 5 chapters are big. Remaining all chapters are very very small. ठीक है? चलो fine. So what are the disturbances of thought? See, a flow of thought or a stream of thought. Flow of thought or a stream of thought, form of thought, content and position. First of all, we are learning about flow of thought. What is the meaning of a stream of thought? When so many thoughts are coming to the mind of the patient, so many thoughts are coming to the mind of the patient at the same time, that is called a flow of thought or a stream of thought. Suppose if you ask the patient, suppose if the patient is your friend, okay, who is in PG first year. Suppose if you ask him only one question, hey, what you are going to do tomorrow? Simple question पूछा आपने. Overall, you have asked only simple question of what you are going to do tomorrow. What is saying? Hey, tomorrow in the early morning, I have to get up, I have to go to my university, I have to take the book. After that, I have to take the daughter of my HOD for shopping. Again, I have to get back to university, I have to take the book. Again, I have to get back to my home. I have to buy vegetables for my mom. Again, I will go to university. I have 5 appointments. I have to meet Ramesh, Mukte, like Suresh. And I'm having so many meetings. After that, I have to get back to university. Again, I have to go back to hostel. I have to go there. I have to do this. I have to do that. See here, you have asked only one question. How many thoughts are coming to his mind? It is called as a flow of thought. It is called as what? Flow of thought or a stream of thought. When so many thoughts are coming to the mind of the patient, it is called as what? Flow of thought disorder or a stream of thought disorder. What are the examples? Like flight of ideas. है ना? Yes. चलो ठीक. चलो अच्छा है. So basically, so like one example is what? Flight of ideas. Flight of ideas. Where do you see flight of ideas? Please write down. It is seen in mania. ये है important, right, doctor? Okay, very good. Flight of ideas is seen in mania. Flight of ideas is seen in mania. Mania. Please write down. In mania, sometimes there can be rhyming words. Sometimes there can be rhyming words and comprehensible word. Basically, which you can understand. Comprehensible word, which you can understand. What does it mean? Basically, see, a flight of ideas. Sometimes if you ask the patient, hey, where do you live? Simple question, where do you live? So how patient is replying? I live in Delhi. I have a cat. She has a big belly. I love to eat jelly. Lily, lily, lily. See here, so many sentence, but Delhi, belly, lily, jelly, right? And so all these are the examples of what? Flight of ideas. See, last time there was a question in FMG exam. Why you silly? Yes. See, last time there was a question in FMG. After getting discharged from the hospital, a patient is saying, I am having so much money. I am going to buy honey for my sweet Sunny. This is an example of which of the following condition? Answer क्या था? Mania. Answer क्या था? Mania. सुनो वो डोर लगा, इनको बोलो क्लास चले जरा बाहर जाके बात कर लो, हाँ? ठीक है? पानी एक और बोतल दो। Easy to understand. Flight of ideas is seen in what? Mania. Mania में क्या है? Rhyming words होता है, which you can understand. Right now, flight of ideas. Flight of ideas. Very easy to understand. I hope all these points are clear to everyone. Suppose if you ask the patient, where do you live? He will say, I live in Kolkata. I wear the shoes of Bata. I am going Tata, Tata, Tata. So this is an example of what? Flight of ideas. Flight of ideas. Mania. Okay, fine. Now, slowing of thinking. Where do you see slowing of thinking? Please write down in depression. In depression. Circumstantiality. Please write down. Giving unnecessary details. Giving unnecessary details before the final answer. Giving unnecessary details before the final answer. मतलब खूब इधर से round and round, मतलब घुमा घुमा के बात करना. So basically, what is a circumstantiality means what? Basically, when a person is giving unnecessary details before the final answer. Before the final answer. Okay, suppose if a senior doctor is there, suppose if a senior doctor is there, and he is asking one intern, beta, which specialization seat would you like to take during your PG? After that, he's saying what? Ki, sir, when I was in second year, I was liking patho a lot. So forensic also good, but after that, when I was posted in pedia department, sir, pedia mein cute babies, cute patient. No, sir. After that, some medicine department, sir. Dr. House, sir. Some medicine department. Nah. Sir, actually, no. One day, what happened with me when I entered surgery department, operation theater? There, I saw, oh my God, surgeons were playing with blood, sir, life, and oh my, sir, I will take surgery, sir, surgery. Kya hua? Giving unnecessary details before the final answer is called as circumstantiality disorder. It is called as circumstantiality disorder. Okay? Giving unnecessary details before the final answer is called as what? Circumstantiality. तो इसका मतलब क्या होता है कि घुमा फिरा करके आंसर कर. डॉक्टर उमेश वो आएगा, don't worry. Okay, now next word is what? Perseveration. Please write down. Unnecessary repetition of same thing. Unnecessary repetition of same thing. If you ask the patient, what is your name? Akash. Where do you live? Akash. What is your father's name? Akash. Everywhere, Akash, 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 Akash. That is called as perseveration. Perseveration. Okay, that is called as what? Perseveration. Okay, perseveration. Okay, fine. Dr. Vishal, some word. Yes. Okay. Next word is thought block. Next word is thought block. Means 100%. जो इसमें लिख लो thought block मतलब क्या? Suddenly blocking of thought. Suppose see, this can be seen in severe anxiety. This can be seen in severe anxiety. This can be seen in severe anxiety. Seen in severe anxiety. See, suppose if a person is having so much of thought, so much of flight of ideas is coming to his mind, suddenly what is happening is suddenly for a few seconds, all thoughts will be blocked. So there will be thought gap. Suddenly there will be gap of the thought. And after that, at least for a few seconds, there will be no thought. After a few seconds, new thought will come. So that is called a thought block. I have taught you 5 examples of flow of thought. Can you give me the example? बोलो एक बार. Inhibition मतलब क्या होता है? Slowing of thinking, Dr. Vidhi. Right? A slow of thinking, right? Slow. I have taught you 5 examples of flow of thought. Flight of ideas, inhibition of thinking, circumstantiality, perseveration, and thought block. See, now without seeing the notes, all of you please write down 4 criteria to diagnose real hallucination. लिखो जरा. All of you please write down 4 criteria to diagnose real hallucination. In the absence of any stimulus. और क्या कहते हैं लिखो. As vivid as real. Outer objective space. Involuntary. I have taught you 5 special types of hallucination. Please write down. All of you write down 5 special types of hallucination. Write down. Hypnopompic, hypnagogic, synesthesia, functional, extracampine. Synesthesia is also called as, bolo, synesthesia is also called as reflex hallucination. Very good. Okay, synesthesia can be seen in which substance abuse? Bolo. LSD and cannabis. So can you define synesthesia ka definition? Please write down in chat box. How do you define synesthesia? How do you define synesthesia? Lysergic acid diethylamide, LSD full form. Okay. Stimulus in one modality, hallucination in another modality. Modality, right? Modality. Okay. How do you define functional hallucination? Bolo. How do you define functional hallucination? Same modality. How do you define extracampine? Beyond sensory field. Suppose if I can see my own imagination, it is called as what? Autoscopy. Autoscopy, right? Very good. Chalo, theek hai. Very good. Theek hai, kafi hai. Okay. So like in this manner, we have completed about flow of thought or a stream of thought. Now, next is a form of thought. We are going to learn what? Form of thought. See, if I show you this bottle, okay, this is having cylindrical shape, right? Okay. Dr. Vinay, then it will be called about extracampine. Okay. Okay, see, when I'm showing you this bottle, this is having cylindrical form. When I show you my mobile phone, okay, this is actually what? So mobile phone mein kya? Yeah, this is rectangular shape. This is having rectangular shape. So basically for everything, there should be proper form. Like suppose if I talk about this room, this is having rectangular shape. So for everything, there should be organization. For everything, there should be form. So even in the same manner for the thought, there should be proper organization. There should be proper association between the thoughts. Suppose if our thoughts are not organized, our thoughts are not associated with each other, now these thoughts will be called as formal thought disorder. है ना, इसको क्या बोले हम लोग, फॉर्मल थॉट डिसऑर्डर. whenever see here, whenever the thoughts are not associated, thoughts are not well organized. Let's learn the examples here. See यहाँ पे लिखो derailment. Please write down first of all derailment. Loss of association between two thoughts. Please write down. Loss of association between two thoughts is called as a derailment. पहले लिख लो. Write down first. After that, I will explain you. Loosening of association, loss of association between the component of single thought. Single thought. Okay, now let's learn these 2 points first of all. What I'm saying is that loss of association between up to two thoughts. What does it mean? Suppose if I ask the patient, what do you know about Indian history? What do you know about Indian history? Simple question मैंने पूछा है. Simple question I asked from the patient. What do you know about Indian history? My patient is saying what? Yeah, Pandit Nehru was the first Prime Minister of India. Sachin scored a century. See here, he could answer so many things. He could answer so many things. है ना? But all historical points should be interconnected, no, well associated. What is saying? Pandit Nehru was the first Prime Minister. Sachin Tendulkar scored a century. So he was going on a rail, suddenly it got derailed. It is called as derailment. When up to two or more than two thoughts are not associated, it is called as derailment. It is called a derailment. Loosening of association means what? Loosening of association. I asked one question. I wanted to hear only one answer. But see, yes, so now there will be what? Loss of association from the single component of thought. I asked my patient, hey, how are you? Asan sa question, easy question. I'm asking a patient, hey, how are you feeling today? How are you? Simple, good or bad, whatever he should, right? He should be answering. So see, now my patient is saying what? I am very hungry. I am very hungry. It will rain today. See, देखो एक ही आंसर होना चाहिए था ना, एक ही आंसर होना चाहिए था उसका, right? So I am very hungry. It will rain today. Suddenly he got what? And suddenly there was what? Loss of association from the single thought. Single answer should have been there, right? No, that is called as what? Loosening of association. Loosening of association. याद रखो. Derailment, multiple thoughts. Loosening of association, single thought. Incoherence, please write down. Total lack of organization. Total lack of organization. Total lack of organization. Basically, whatever patient is saying, you are not understanding. Total lack of organization means what? Suppose if you ask the patient, hey, where do you live? After that, he's saying what? Andhra Pradesh, Mark Zuckerberg, Facebook, Instagram. Did you understand anything? बोलो कि अभी तुम कहना क्या चाहते हो भाई? That is called as what? Incoherence. Whatever patient is saying, you are not able to understand. That is called as incoherence. That is called as incoherence. Incoherence. Total lack of organization. Now, next word is tangentiality. Please write down the meaning here. Answering in a distant related manner. Answering in a distant related manner. See, whatever question you are asking from the patient, a patient is answering you, but his answer is somewhat distantly related to your question. He will never give you direct answer. He will never give you direct answer. Suppose if this is the question, this should be the answer. ऐसे ही होता है ना? Suppose if this is the question, this should be the answer. But here, suppose if you are asking any question from the patient, no, so his answer is somewhat like this. Like suppose if you are asking the patient, hey, who is your favorite actor? Who is your favorite actor? Patient is replying what? Yeah, Bollywood is all about romance. Hollywood is all about action. He will never give you the exact answer. He will never give you the exact answer. His answer will be somewhat distantly related to your question. That is called a tangentiality. If you ask the patient, what do you know about Albert Einstein? What he's replying? Yeah, science is a branch which is based on research and experimentation. Basically, है ना, हाँ, जितने politician लोग का जो answer easy to understand means you will never get a direct answer. You will never get a direct answer. Answer will be distantly related to your question. See, in class 9th, see here, yes. See, in class 9th, you would have learned in the mathematics that a line which is going to touch only a point of circle, which is not going to touch the center, a point which is going to touch. Yes, Dr. Enthusiastic. And I see here, a line which is going to touch only one point of circle and go away. इस line को क्या बोलते हैं? This line is called the tangent line. So tangent से बन गया tangentiality. ठीक है, so this is never going to touch the circle. This is never going to touch the center basically, right? But suppose if I'm making a diagram like this, round and round, and finally it is going to touch the center. Now what will be the answer? Circumstantiality. And now answer will be what? Circumstantiality. Now I hope there is no confusion between circumstantiality and tangentiality. Okay, Dr. Swarnima is writing boys who are unable to express their emotions, their feelings. Yes, so there can be tangentiality. Yes. है ना, अरे तुम्हें पता है मुझे लाल रंग अच्छा लगने लगा है आजकल, राइट? है ना? Okay, fine. So see, always keep in mind circumstantiality means what? Giving unnecessary details before the final answer. Before the final answer. And the tangentiality means what? Answering in a distant related manner. Answering in a distant related manner, right? Okay, Dr. Saurabh, yes. Neologism means what? Neologism means to coin a new word. To coin a new word. Neologism is to coin a new word. New word. 100% new, which was not seen in any dictionary or in any Wikipedia or anywhere. Suppose if there is a 19-year-old boy who wants his pen. He is asking his mom, I need my Tintin Tappa. What? Mom, I need my Tintin Tappa. Arre, what do you want? Mom, please give me my Tintin Tappa. Arre, what do you want? Mom, just now I coined a new word for the pen. Please give me my Tintin Tappa. And this is called as what? Neologism. Gen alpha. Okay, whatever. Yes. And that is called what? Neologism. Neologism. It is called what? Neo means what? To coin 100% new word. Metonyms, please write down. Metonyms means what? Using old word in a new fashion. Using old word in a new fashion. Yes, Dr. Vilash. And please write, metonyms means what? Using old words in a new fashion. That is called as metonyms. Please write down. See, it is also called as a word approximation. Please write down. It is also called as a word approximation. Word approximation. It is called as what? Word approximation. Right? See, using old word in a new fashion. Suppose if I am standing in operation theater, I want surgical gloves. I want surgical gloves. I am asking the nurse, I need my hand socks. Hand socks. I need my specs. No, so I'm asking what? I need my eye cover. I need my eye cover. I need the time vessel. For the wristwatch, what I'm saying, I need the time vessel. Right? So all these are called as what? Metonyms. Metonyms. Metonyms, right? Okay, now next word is clanging. Please write, clanging means what? Rhyming and incomprehensible. Rhyming and incomprehensible. Rhyming and incomprehensible words. Rhyming words will be there, but you will not be able to understand. You will not be able to understand. That is called a clanging. Like if you ask the patient, what is the meaning of fragrance? What do you say? Absence, nonsense, presence, fragrance, flatulence. Overall, did you understand anything? Although these were rhyming words, but you could not understand, right? These words are called as clanging. These words are called a what? Clanging. So see here, all a form of thought disorder. Always keep in mind, at least one form of thought disorder will be seen in schizophrenia. At least one form of thought disorder will be seen in schizophrenia. One form of thought disorder will be seen in schizophrenia. Neologism is very commonly seen. Metonyms, derailment, loosening of association, very commonly seen among schizophrenia patients. Without seeing the notes, can you give me 5 examples of flow of thought disorder? Bolo zara. Bolo, flow of thought. Or a stream of thought. Bolo, all of you. Depression? No. Flight of ideas, slowing of thought, or circumstantiality. After that, perseveration. And then after the thought block, right? Thought block. Okay, very easy to understand. Okay, chalo, fine. See here, so in this manner, we have completed flow of thought, form of thought. Now, next word is content of thought. Next word is content of thought. What is actually there in the mind of the patient? What is the actual content of thought of the patient? See, solve this question now. Solve this question. Yes, delusion is a disorder of thought. Next question. Yes, delusion is a disorder of content of thought. So how do you define delusion? Please write down. How do you define delusion? Please write down. How do you define delusion? Delusion is a false form, fixed and unshakable belief which is based on irrational ground, Please write down. मतलब delusion के बारे में, see, for delusion, always keep in mind, even if you are not able to recall all this point, please keep in mind false and fixed belief, which is unshakable. Suppose if you are saying that, like suppose if the patient is saying that he is most powerful person on the earth, as per his content of thought, he is unshakable belief. Unshakable belief. That is called as delusion, right? And that is called as what? Delusion. False, firm, fixed and unshakable belief based on irrational ground. Based on irrational ground. Irrational ground. I hope all these points are clear to all of you. Now let's learn all delusions one by one. See here, overall, what are the most common type of hallucination? Bolo. Overall, most common type of hallucination? Auditory. Organic mental disorder में बोलो visual. Temporal lobe disorder में बोलो temporal lobe, olfactory and gustatory. Okay, fine. ये बता cocaine abuse में cocaine. Very good. Okay, now let's learn all delusion one by one. Please write down overall most common type of delusion. Likho, most common type of delusion is delusion of persecution. Delusion of persecution. Here patient will be having this kind of belief that someone wants to kill me, someone wants to harm me. Here patient is having this kind of belief that someone wants to harm him, someone wants to kill him. Okay, delusion of persecution. Delusion of reference, please write down. Referring self. Referring self. So basically, whatever is happening in and around the patient, or patient will be referring himself. This is happening because of me only. Because of me only. Okay, because of me only. Right now, see, like suppose if there is a big auditorium, suppose if AC fell down, what patient will say? I kept my hand in my pocket, that's why AC fell down. एक बार क्या बोलेगा? Suppose if he is using a public transportation, suppose if he is in a bus, after the inner corner someone else is having any kind of conversation, what is saying? That they are talking about me. They are talking about me. So basically this is called as what? Delusion of reference. Delusion of reference. Next word is delusion of love. Little delusion of love. First year MBBS, very common. First year MBBS, very common. Or maybe see, suppose if a boy is saying what? The most beautiful girl of my batch, she is in deep love with me. She is in deep love with me. इसको क्या बोलेंगे? Delusion of love. या फिर suppose if a rickshaw puller is saying what? Angelina Jolie is my girlfriend. Aishwarya Rai is my girlfriend. So that's why it is also called about fantasy lover syndrome. See, fantasy is free of cost. आराम से ठीक है भाई, enjoy करो, enjoy. Fantasy free of cost. That's why it is also called about erotomania. Difficult. See, the difficult word is Declarambol syndrome. So basically, देखो, see, fantasy anyone can have. Fantasy anyone can have. Anyone can have fantasy. But remember here, suppose if a rickshaw puller is saying, he's saying that Angelina Jolie is his girlfriend. Angelina Jolie is his girlfriend. What he's saying that? Angelina Jolie. When so see, the rickshaw puller, his age is only 28-year-old. He is only 28-year-old. So when his mom is asking, beta, you get ready for marriage. You get ready for marriage. Right now, what is it? No. I don't want to see any Indian girl. My Anju is crying there. Saath Samandar par. Anju means Angelina Jolie. Angelina. So what he's saying? My Anju is crying there. He doesn't want to see any Indian girl. Huh? Now there is problem. Now he needs to see a doctor. He needs medicine. Okay, this is called as delusion. Delusion of love. Delusion of love, which is also called as erotomania. Erotomania, right? Now, this is also called what? Erotomania. Easy to understand? ठीक है, समझ में आएगी बात? Right? Chalo, fine. Okay. So now see it. See, over also delusion of love is very common word. Remember, yes, some other terms for delusion of love, also called as erotomania, also called as fantasy lover syndrome, also called as Declarambol syndrome. Delusion of grandiosity. I am feeling I'm the most powerful person on the earth. I'm the president of India. I am Prime Minister of India. That is called a delusion of grandiosity, right? Grandiosity. Dr. Lohit, Stockholm syndrome, you are asking from money heist, right? A money heist se puch raha, Stockholm syndrome, huh? And when any hostage will be in love with, like with the kidnapper, with the robber, with that person, right? उसको बोलते हैं Stockholm, वो different है. And उसमें दिखाया था, money heist में दिखाया था, right? Okay, delusion of grandiosity. Delusion of negation. Delusion of negation. यानी कि अगर किसी हॉस्टेज को वहां पे किडनैपर से प्यार हो जाए, उसको बोलते हैं स्टॉकहोम. ओके डॉक्टर लोहित. नाउ डिल्यूजन ऑफ नेगेशन और nihilistic delusion, also called a Cotard syndrome. Please write down. Okay, when a person is claiming of non-existence of something, non-existence of any body part. Please write down. When a person is claiming of non-existence of any body part. When a person is claiming of non-existence of any body part, it is called as what? Delusion of negation. Also called as nihilistic delusion. Cotard says, suppose if a person is saying what? I am having empty skull, you know, my like aliens have stolen my brain. Aliens have stolen my brain. It is called a delusion of negation. Suppose if a patient is saying what? Ki yesterday my friend, he left to USA and he stole my pancreas. He stole my pancreas. So it is called a delusion of negation, also called as nihilistic delusion. Abhi question aaya tha, last time INI-CT question. A severely depressed patient is sitting in OPD and he is saying he cannot eat the food. On asking why you can't eat the food, he's saying, I cannot eat the food because I do not have head. Which type of delusion is this? Delusion of negation. Negation. Ye question the last time INI-CT question. Okay. Negation is also called a nihilistic, also called as Cotard syndrome. Also called as Cotard syndrome. Cotard. Delusion of infidelity. What is the meaning of infidelity? Overall, what is the meaning of infidelity? Cheating on a spouse. Cheating on spouse. Okay. Okay, extramarital affair. Extramarital affair is called as what? Delusion of infidelity. It is also called as morbid jealousy or the pathological jealousy. So this will be more common among male or female. Extramarital affair, that my spouse is having extramarital affair. More common among male or female? Okay, please write. It is more common among male. Male. And more common in alcoholism. Alcoholism. So therefore, Shakespeare wrote a novel on extramarital affair, on infidelity. That was, name of the novel was Othello. So it is also called what? Othello syndrome. Othello syndrome. See, देखो यहाँ पे yes, Dr. Bharat. Yes. See, देखो यहाँ पे कि अगर मान लो suppose if a husband is having, suppose if a male is having, suppose if a husband is having this kind of delusion that his wife is having extramarital affair. His wife is having extramarital affair. Okay. So every day he will be fighting. Whoever the guest is coming to the home, he is keeping eyes. Every night he keeps on rechecking her phone again and again. ठीक है, phone बार बार check करती है phone, है ना, phone बार बार check करता है. So every day because of this he is fighting. After 1 month there is a divorce. After 1 month there is divorce. Okay, chalo fine, happy ending. Suppose if a wife will be having this delusion, no. Suppose if a wife will be having this syndrome, right? Then situation will not be easy. Usme situation will not be that much easy. There will be no divorce. Say in the beginning, when a wife will come to know about extramarital affair, no. In the beginning, she will be silent. When she will be confirmed, after 1 month, when husband will be sleeping, she will remove the pant off, and after that she will cut the genital organ. She will amputate the genital organ. It is called as Bobbitt syndrome. See, it is called as Bobbitt syndrome. Dr. Swaroop, I will take FMT. Don't worry, I will take FMT. Abhi psychiatry time hai, theek hai? Okay, fine. I will take FMT. FMT will be repeated completely. Okay, fine. This is called about the Bobbitt syndrome. It's called about. So many cases are there in the newspaper, you can hear. Okay, so over what is the meaning of Bobbitt syndrome? Amputation of a male genital organ by the female partner. Please write down Bobbitt syndrome. can be seen, it can be seen with delusion of infidelity. This can be seen with delusion of infidelity. Okay, delusion of infidelity. Okay, now delusion of enormity. Please write down the meaning of delusion of enormity. Delusion of enormity, please write down. Where patient is having this kind of belief that any of my actions, any of my action can bring a big disaster. Any of my actions can bring a big disaster. That is called a word delusion of enormity. So क्या बोलेंगे? Delusion of enormity. Delusion of enormity. Here patient will not be sneezing openly. He will not be coughing openly. वो ऐसे ऐसे खांसी करेगा. कैसे कैसे खांसी करेगा? Overall, he will be coughing like this. So on asking why do you cough like this, he will say, no. If I cough openly, no, entire city of Jaipur will be blown away. Entire city of Hyderabad will be blown away. So that's why I'm not coughing openly. He will not be passing the urine in public place. Susu nahi karega public place pe. He will not be passing the urine in public place. Why? Because he is thinking that because after this there will be biggest flood in the history. After this यहाँ पे बाढ़ आ जाएगा. तो ये क्या delusion है? False belief. This is called as delusion of enormity. Delusion of enormity. Delusion of guilt. See, it can be seen in severe depression. This can be seen in severe depression. See, this can be seen severe depression. Severe depression. Delusion of guilt. 15 years back, one of your batchmates, he borrowed 1 rupee from you. After 15 years, you people are meeting and he is asking you what? Hey, I could not return your 1 rupee. No, oh my God, because of the, oh my, I have committed the biggest sin of my life. Even the God is not going to forgive me, no? Oh my God. I got to know that you are going through financial crisis. Okay, only because of me only you become poor. Seriously, man, I'm so sorry. I'm so sorry. I'm so sorry. What is this? Delusion of guilt. 8 types of delusion I have taught you. Remember here, all delusions are very, very important. Okay. Overall, what is the most common type of delusion? Can you answer me? Overall, what is the most common type of delusion? Delusion of persecution. Delusion of persecution. है ना? Delusion of persecution. Right? Okay, fine. ये बताओ. Where we have learned about de Clermont syndrome? Can you answer me? Where we have learned about de Clermont syndrome? Which delusion? Delusion of love, right? Delusion of love, also called a fantasy lover syndrome, right? Okay, where we have learned about Cotard syndrome, bolo. Negation. Where we have learned about Othello syndrome. Othello syndrome, bolo. Othello syndrome. Delusion of infidelity. Delusion of infidelity. Very good, very good. Okay, okay, all right. See, देखो now, so there is one more classification of delusion. One is called as bizarre, another is called as a non-bizarre. See here, a type of delusion which is impossible. Impossible and unacceptable. A type of delusion which is impossible and unacceptable. That is called as bizarre delusion. Bizarre. Impossible and unacceptable. See, when I talk about delusion of negation, suppose if a patient is saying that someone has stolen his brain, scientifically impossible, and no one is going to believe it, right? So that is called as what? Bizarre. That is called as bizarre, right? That is called as bizarre. Right? That is called as bizarre. Okay. Okay, easy to understand. Okay. DON is what? Delusion of negation. See, someone is saying what? Someone has stolen my brain. And someone has stolen my brain. So this is impossible, no? इम्पॉसिबल है। या फिर अगर बोलोगे क्या किसी है, एनी ऑफ माई एक्शंस कैन ब्रिंग अ बिग डिजास्टर। सपोज इफ अ पर्सन इज सेइंग व्हाट, कि व्हेन आई कॉफ एंटायर सिटी विल बी ब्लोन अवे, दिस इज बिजार। इम्पॉसिबल, नो, इम्पॉसिबल। नॉन बिजार मीन्स व्हाट, दिस कैन बी फॉल्स but this can also be right. This can be false and this can be, है ना? See, suppose if I like, when I say delusion of persecution, when I say delusion of persecution, मतलब क्या हुआ? delusion of persecution मतलब क्या होगा? Suppose if a person is saying what, कि my brother wants to kill me, क्या कह रहा है? My brother wants to kill me. See, this can be false, but this can be true also. Now, for the property distribution, this can be true also. So you can say delusion of persecution is a non-bizarre, but delusion of negation is bizarre. मतलब bizarre का मतलब क्या हुआ? Impossible. Non-bizarre, this can be possible. याद रहेगा ये? Bizarre and non-bizarre, please keep in mind. Please keep in mind. Okay. So we have learned about, देखो यहाँ पे क्या क्या हम लोगों ने पढ़ लिया है? Flow of thought, form of thought, and content of thought. Last is what? Possession of thought. See, basically, what is the meaning of the possession of thought? See, देखो पहले ये जरा फोटो देख के बताना है क्या? ये बताओ, which type of delusion? Which type of delusion? आरसीबी कैन विन आईपीएल? नहीं, ऐसे नहीं बोलते यार। वो तो पॉसिबल है ना यार। तो पिक्चर नंबर 1 इज डिल्यूशन ऑफ ग्रैंडियोसिटी। पिक्चर नंबर 2 क्या बताओ? पिक्चर नंबर 2 डिल्यूशन ऑफ प्रोसिक्यूशन। ओके, पिक्चर नंबर 3 बोलो क्या है ये? दे आर टॉकिंग अबाउट मी, है ना? दे आर टॉकिंग अबाउट मी। ओके फाइन, पिक्चर नंबर 4 बोलो। डिल्यूजन ऑफ इनफिडेलिटी ना, फोन चेक करा बार बार उसका, राइट? ओके, ये बताओ पिक्चर नंबर 5 बताओ, ये क्या? डिल्यूजन ऑफ half part of our face does not exist. Half part of our face does not exist. So nihilistic delusion, delusion of negation. Now last is the possession of thought disorders. What is the meaning of possession of thought? Here patient will be having this kind of belief, this kind of feeling that his thoughts are under the control of someone else. His thoughts are under the control of someone else. One is called as what? Thought alienation. Another is called as obsession. So thought alienation means what? When a patient is having this kind of feeling that someone else can control the thought of the patient. Someone else can control the thought of the patient. So what is the meaning of thought insertion? Someone is inserting some thoughts in my mind. Like क्या होता है? जैसे मान लो कि suppose if a patient was sitting over there, suddenly he is going to enter his hand in the running fan. After that, when you asked him, hey, why did you do like that? No, someone has inserted this thought in my mind. That's why I did like this. See, 1 year back, there was question in FMG. One schizophrenia patient is saying that aliens are sending radiations to his brain and asking him to kill his neighbors. This is an example of what? Thought insertion. This time also, there was one question related to thought insertion. This time also, there was question related to insertion. Okay? So where patient is having this kind of belief that someone can insert some thoughts in the mind. Thought withdrawal, someone can withdraw my thoughts. Same like ATM machine se paise nikal lega. Someone can withdraw my thoughts and utilize it. Thought broadcast, oh my God, whatever I'm thinking now, everyone can know about my thought. That is called a what? Thought broadcast. Sabko pata chal jayega. So what are the examples of thought alienation? Insertion, withdrawal, broadcast. Insertion, withdrawal, broadcast. Very easy to understand. I hope all these points are clear to everyone. Okay, na? Okay. Obsession means, what is the full form of OCD? Dr. Ashwini just now explained, no? So withdrawal means what? Someone can withdraw my thoughts and use it. Whatever I am thinking, someone can withdraw my thoughts and utilize it. My ideas can be utilized by someone. Okay? OCD, obsession and compulsion. Whenever a person is having uncontrolled thoughts, when a person is having uncontrolled thoughts, okay, uncontrolled thoughts are called as obsession. When a person is having uncontrolled thoughts that your hands are dirty, 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 wash it, wash it, wash it. He knows that these thoughts are irrational. He knows that these thoughts are weird. And these thoughts are weird, but he cannot control. So whenever he wants to control, he is having anxiety. And just to release the anxiety, he has to wash. This action is called as compulsion. This action is called as compulsion. So this is called as obsessive and compulsive disorder. So please write down thought alienation and obsession. Obsession, these are the examples of disturbances, the possession of thought. What is the meaning of broadcast? When a patient is having this kind of thought process that his ideas are being broadcasted. Now everyone can know about the ideas of the patient. That is called a thought broadcast. Thought broadcast. What kind of question they have framed? Derailment is a disorder of flow of thought, form of thought, content of thought, or possession of thought. Answer karo. Answer please. Derailment is a disorder of form of thought. Form of thought, no form of thought, right? Form of thought. Okay, fine. Ye batao. See here. Othello syndrome is a disorder of flow of thought, form of thought, and the content of thought, or possession of thought. Okay, content of thought. All delusions are the example. Very good. All delusions are the examples of what? Content of thought. Obsession is an example of what? Obsession is an example of form of thought, flow of thought, content of thought, or possession of thought. Yahi question hai. Okay, this is the question. This is the question. Okay, this is the question. Very easy to understand. I hope all these points are clear to everyone. Whatever I'm teaching you, all these points are important for your exam. Now see this question. Now, some words are 100% new. का मतलब क्या होगा? Neologism. Some themes are a disjoint loosening of association. So ये जो है neologism, loosening of association, derailment, ये सब कहाँ है? These are, yes, these are the example of form of thought disorder, no? These are form of thought. In this manner only they are framing the question. In this manner only they are framing the question. Okay? Form of thought. Very good. Very good. है ना? ऐसे बनते. देखो, see this question now. Dr. Mupin, broadcast means what? Here patient is having this kind of belief that his thoughts are being broadcasted. Now everyone will be able to understand about his thought, about his ideas, about his planning. That is called a broadcast. Okay, withdrawal means only one person can withdraw and utilize. This is a case of what? Yeah, this question, delusion of love. De-Clermont syndrome. Simple. In this manner, they are framing the question. Now see here, so last topic here, how to assess higher mental function. How to assess higher mental function. Please write down. Suppose if I have to check the attention level of the patient. Yeah, this question here, answer is what? See. Oh, sorry. Dekho, yeah, this question, ye kya yahan pe? When he looks at his wife, no. So this is what? Delusion of infidelity, no? So answer will be C, sorry. Answer will be Othello syndrome. Yeah, this is a case of a delusion of infidelity. Infidelity, so Othello syndrome. Okay? Chalo, fine. See, dekho, now suppose if I have to check the attention level of the patient, no? Attention level of the patient. So I will give him a task. You have to count the number at the interval of 2. Dr. Salwa Faizan, I will explain you again. Okay, so just this is the last topic. I will finish. After that, I will explain again. I will see. Yes, so what is the meaning of C here? Suppose if I want to check the attention level of the patient, I will give him a task. I will give him a task. Okay. I will give him a task that you keep on counting the number at the interval of 2. So he will be counting like 2, 4, 6, 8, and 10, and 12, 14. At the span of a digit, it is called as digit span test. So digit span test, especially we are using to check the attention level of the patient. Okay. So it is also called a digit repetition test. Digit span test is also called as a digit repetition test. Repeat karna at the interval of 2 or at the interval of a digit. Now, higher level of attention is called as concentration. Higher level of attention is called as concentration. Higher level of attention is called as concentration. For this, I will give a difficult homework to my patient, a difficult task. Subtract 7 from 100 and keep on counting up to 6 to 7 digits. So he has to subtract like this. 100 minus 7 equal to 93. After that, he has to count like, doctor, 100 minus 7 equal to 93. After that, 86, 79, 72, 65. Let's see here. I can easily count because every time I speak the same thing. But the patient, I want to check his concentration level. How he's going to count? Doctor, 100 minus 7. Okay. 100 minus 7 equal to 93. After that, 86 and then 79. And Dr. India-Pakistan match was going. Did you see the match? Oh, how beautiful that match was. See, suddenly he has loss of concentration. Easy to understand. This is called a serial 7 subtraction test. Serial 7 subtraction test. Very easy to understand. No problem. Weak in maths, no issues. Serial 7 subtraction 1 year back, this was FMG question. Serial 7 subtraction test, especially to check concentration level. Okay. Now, see, देखो यहीं पे एक लिख लो, especially for digit span test. Please write down digit span test. Digit span test. See, overall, whenever a patient will be counting like this, no, 2, 4, 6, 8, 10. This is a forward. Suppose the patient will be counting like 8, 6, 4, 2, 0. That is backward. Please write down digit span forward test is better. For attention, concentration also, immediate memory also. Please write down immediate memory also. Immediate memory. Immediate memory. Overall, what is the meaning of immediate memory? If you ask me what I'm doing now, I'm taking my lecture. This is my immediate memory, right? Okay, so please write down digit span forward test is a better test. Digit span forward test is a better test. Digit span forward test is a better test. Okay, digit span forward test is a better test. For attention, concentration, immediate memory. Attention also, concentration, all C for concentration also, and immediate memory also. Especially if they are asking you 100 minus 7 equal to 93, especially for concentration. Especially for concentration. Very easy to understand. Yeah, Joanna, yes, see, this was the question. 1 year back, this was the question in FMG. 1 year back, this was the question. Okay. 1 year back, this was the question. Okay. Now, what is the meaning of this one? What is the meaning of the proverb test? I'm asking one proverb. एक मुहावरा पूछेंगे patient से. I'm asking a proverb from the patient. What do you mean by health is wealth? He's not answering. After that, if I'm asking him, what do you mean by a pen is a mightier than sword? A pen is mightier than the sword. A pen is stronger than the sword. After that, my patient is replying what? Yeah, your pen might be a 15 kilogram. Basically, he is not understanding the deeper meaning of my sentence. He is not able to abstract. So please write down. So these we are using for abstract thinking. Please write down abstract thinking. So these we are using to check what? Abstract thinking. Abstract thinking. I want to know whether my patient is able to understand the deeper meaning of my sentence or not. ज़्यादा अंदर तक वो समझ पाता है या नहीं? That is called as what? Okay, this is called the proverb testing. And one more test is the similarities testing. Similarity testing में क्या? If I ask the patient, hey, what is similarity between a table and chair? Suppose the patient say, yeah, both are on the floor. Is not able to understand the deeper meaning. Suppose if he's saying, yeah, both are made up of woods. Now it's good. It is called about similarities testing. Please write down. Similarities testing and proverb testing. Both we are using to check what? Abstract thinking. Abstract thinking. Okay? Abstract thinking. Now, next important is what? I want to check the judgment power of my patient. I want to check the judgment power of my patient. So I will give him a test. I will give him a test. I will give him a situation. Hey, what will you do if you see a house on fire? What will you do if you see a house on fire? My patient is replying, what? I will make a selfie. His judgment power is not normal, right? This is called a test judgment. This is called a what? Test judgment. Test judgment. समझ में आ गई बात? Test judgment. Last, what was the meaning of insight? Awareness about disorder. See, there are different parameters of insight. See, some people will be having zero insight, like schizophrenia, 100% unaware about disease. Some people can have some insight, right? Or some 50% or 10%, right? So judgment power means what? Where a patient, see, like I will explain you. देखो, judgment power में समझो एक और चीज, judgment power. या देखो, I will give him a test. I will give him a task. And I would like to check whether my patient is able to take normal judgment or not. See, there was a question in FMG that a clinician is asking his patient, what will you do if you see an envelope lying on the floor? Patient is replying, I will kick it. What does clinician want to check? Judgment power. This is called a what? A test judgment. यानी कि एक सही टाइम पे सही डिसीजन ले पा रहा है या नहीं. Okay. Now, insight, awareness, please write down. Some people can have zero, some people can have some insight. But see, especially you have to write about two types of insight. Intellectual insight, intellectual and emotional. Here, patient is 100% aware about disease. 100% aware about disease, but he does not want to take any action. Here, patient is aware. Okay, fine. I'm having some problem. I know this fact. Okay, I know this fact. I'm having some problem. All right, I can manage it. I can manage it myself. He doesn't want to see the doctor. It is called what? Intellectual insight. Emotional insight. Person is 100% aware and he wants to take action also. He wants to take action also. See, emotionally now he understands that he is suffering from a problem, and because of his problem, his family members are suffering. So he wants to take action also. He wants to meet a doctor also. He wants to take the medicine also. So that's why it is called as highest level of insight. This is old question. Please write down. Emotional insight is highest level of insight. Highest level of insight is called as emotional insight. Highest level of insight is called as emotional. Okay? Okay, fine. Solve the question now. Solve the question now. Single number, then two number, then three numbers. So basically at the span of a digit, no. At the span of a digit, so answer is A only, no. Answer is a digit span test. Serial 7 subtraction test का मतलब क्या होता है? 100 minus 7 equal to 93. Okay? वो होता है serial subtraction test, no? Okay? चलो fine. Okay, doctor, you asked the meaning of obsession, right? Obsession means, solve karo, question karo, solve. See, obsession means what? Uncontrolled thoughts. Obsession means uncontrolled thought. That was the obsession. That was the example of the possession of thought, where patient is having this kind of feeling that he does not have any control over his thoughts. Okay, that was the meaning of obsession in the possession of thought. Solve this question. Most of you are answering A. Wrong answer. Read the question again. Psychosis being differentiated from neurosis with the presence of insight, reality, and awareness are present in neurosis, not in psychosis. Psychosis में क्या present है? Delusion होगा. Answer is C. Answer is C. Read the question properly. Ames question. No problem, Dr. Archana, no issues. Single person means a delusion, false belief. Number of people है ना, तो superstition. Ames question. Next question. Synesthesia, right? ये देखो, ये जो है ना, जैसे यहाँ पे आंसर क्या हो जाएगा? आंसर विल बी ए ओनली. दिस इज कॉल्ड द टेस्ट जजमेंट. सोशल जजमेंट का मतलब क्या होता है? व्हेन यू आस्क अ पेशेंट हाउ विल यू बिहेव इन अ मैरिज फंक्शन, हाउ विल यू बिहेव इन अ ग्रेवयार्ड, व्हाट इज द मीनिंग ऑफ द पर्सनल जजमेंट? इफ यू आस्क द पेशेंट व्हाट वुड यू लाइक टू बिकम इन फ्यूचर, है ना, यानी पर्सनल क्वेश्चंस. नेक्स्ट देखो. Most important, to harm him, and everyone is actually speaking about him, right? So reference भी हो जाएगा. Answer is D. D. Next. I think you are asking very, very big question. A very big question you can ask me separately on Telegram or Instagram, because here so many messages are coming and I will not be able to read entire text. Loosening of association is an example of formal thought disorder. Labile affect. Yeah, this question was asked in Ames. Anhedonia. Anhedonia. Dr. Ahmed Nazir? No. Dr. Shenit? No. Judgment is only the judgment power. Insight means what? Awareness about disorder. Abstract thinking is 100% different. All these are higher mental function. Abstract thinking means what? I want to see whether my patient is able to understand the real meaning or not, right? Severely depressed patient. digit span forward test is better. Digit span forward is better. Dr. Sahala Ali Babu, like here B, a nihilistic delusion, right? Nihilistic delusion. See this question. Dr. Parikshi, Ekbom syndrome I will teach you. That will be in the sleeping disorder. B only, right? Dr. Vishal, here only B है, C नहीं होगा ना? Unnecessary details before the final. See, finally he is answering, no? Finally he is answering the question, no? So this is a case of what? Circumstantial. So this is a case of yes. Now when I talk about A, option A, here final answer will never be given. Final answer will never be given. So remember here answer will be circumstantiality. ठीक है? तो आज के लिए यहीं पे we can stop here now. See you tomorrow by 11 o'clock. See you tomorrow by 11 o'clock tomorrow. Okay? See you tomorrow at 11 in the morning. Okay? Chalo, yeah. Fun class. How much we have learned today? Please revise it well. ठीक है? As tomorrow it will be somewhat longer class. Okay, we can start by 11, we can go up to 7 or 8 tomorrow. Okay, ठीक है? नहीं, ये सब्जेक्ट पूरा होगा. और डॉक्टर शिनित, I will explain you about IPCs and all. No, last class will be day after tomorrow. Dr. Vishal, circumstantiality, earlier it was form of thought disorder, but now as per the new classification, it is a stream of thought disorder. See, for forensic, last time I left one day class, no, but actually so many new students came. So forensic class, forensic will be done again in detail, पूरा होगा, ठीक है? Yes. I will be starting forensic from page number 1 to last. Okay. Okay, no issues, Dr. Ashwin. इसमें question number 3, 1, 2, 3. Okay, fine. ठीक है, चलो. So this question you asked, Dr. Salva Faizan, I think you asked about obsession, right? So obsession I explained. So I have to study the last class of forensics. So like I can do one thing. No? So similar topics I will be starting from day 1, day 2, and day 3. I will keep like last day के लिए separate रखेंगे, so you can so you can attend only last one. Sir, inside table. अच्छा, ये वाला क्या? This one. Okay, this one. देखो यहाँ पे this question में क्या है? Dr. Salva Faizan, देखो, so many questions are asking, so many students are asking, what about the new IPCs? What about new CRPCs? देखो, new IPCs will be implemented from 1st July. We may expect on 6th July. So there are some important, which I will explain you. First of all, let them like implement all. After that, like we will discuss with the fellow colleagues also. After that, whatever will be important for your exam, that I will explain you. Don't worry. ठीक है? तो यहाँ पे क्या? See, in this question, no, psychosis is being differentiated from neurosis with the present. What is present in psychosis? So delusion is present in psychosis. Here, false belief shared by a number of people is superstition. Reflex hallucination is a morbid variety of synesthesia, right? See, if a person is asked what will he do if he see house on fire, so this is an example of the test judgment, right? Chalo fun. I hope all these points are clear to everyone. Okay? All right. Sir, if you teach us all subjects तो चलो ठीक है. Psychiatry forensic, maybe some time मिला तो we'll see. Okay, कुछ और पढ़ा दूंगा CCD and all. Okay, चलो, thank you so much. See you tomorrow. All right. Yeah. पेज नंबर 9 कैसे समझ में आ गया बताओ, बताइए कि टॉपिक है पेज नंबर 9 क्या, बताओ टॉपिक क्या था डॉक्टर नहीं तो व्हाट वाज द टॉपिक? हायर मेंटल फंक्शन यू आर आस्किंग. ओके, ये दिस वन राइट. सर्जरी पढ़ा दो. चलो पहले अभी ये सब फिनिश करते हैं, बाकी बात का है ना. डिजिट स्पैन टेस्ट फॉर अटेंशन, serial subtraction test for concentration, proverb test similarities for abstract thinking, test judgment only judgment power. ठीक है. So now I hope all these points are clear to everyone. ठीक है. डॉक्टर स्वरूप किस चीज में हो रहा है आपको कंफ्यूजन? पैथो. पैथो कंप्लीट है. पैथो कैसा हुआ था? पैथो, हाउ वाज द पैथो क्लास? आर यू पीपल कंफर्टेबल इन पैथो? नॉट गुड. अच्छा, मोर देन हाफ नो पैथो नो फिजियो. अच्छा, नो डॉक्टर स्वरूप. So terms you will have to revise again and again. Surgery took up to 20 days. Acha. No, some situation I think there was some problem with the faculty. Chalo, we'll see. But overall, we are going to finish. Let's see here. All the faculties are supposed to finish everything on time. So okay, chalo, we'll see. I'll say Sarah ma'am gave her best. Okay. ठीक है, चलो, very good. ठीक है. First of all, you finish all the subjects. After that, like even during a rapid division, like subjects will be covered also, right? Or there'll be a rapid division test and discussion also. Physiology नहीं हुआ होगा, वो भी होगा. जून में only rapid division. Okay, Dr. Nihit Kumar, yeah, it will be there. It will be there. See, the subjects which are left will be completed. Okay, don't worry about those subjects. होगा, सब होगा. Don't worry. Okay, सब होगा. Don't worry. चलो ठीक है फिर. हाँ, ओके देन, सी यू टुमारो. चलो आज का रिवाइज करो. सी यू टुमारो बाय 11 o'clock. ओके, चलो देन. ओके, बाय बाय. बाय बाय. थैंक यू. गुड नाइट. गुड नाइट. पैथो एंड फिजियो होगा आपका. ठीक है, होगा. यस. नहीं, रैपिड डिवीजन में गोल्डन पॉइंट्स होते हैं. गोल्डन पॉइंट्स विल बी कवर्ड. मोस्ट इंपॉर्टेंट टॉपिक्स विल बी कवर्ड, राइट? चलो देन. ओके, ठीक है. आई एम साइनिंग ऑफ. थैंक यू. ओके, बाय.